Today's topic of discussion is very important because a lot of the problems start from this point. And if we can handle this particular situation or incident, I think you can prevent a lot of aggressive reactions that you get to see, in a full-blown manner. It could be like patient party becoming aggressive or violent or even calling police or going to the extent of litigating the hospital or the doctors. So, if I may ask you, uh, who all attend to the complaints, by the way? Who all should learn how to handle the complaints? Yeah, Deepika, go ahead.
Actually, I used to when I joined the course previously, but now I've moved to another role. So currently, I'm not handling. But when I was administrating a medical center here, then my day in and day out was handling complaints when it was not resolved at the floor level.
Okay. So, how comfortably were you able to handle the situations?
Yeah, so as I told in the last discussion, most of the time, when by the time it reaches to me, they would have tried different levels and it would not have got sorted. And the patient would be either very furious that there was a lot of time delay and all. And most of the complaints here, since in Qatar we have a lot of private centers handling only the primary level of care. We used to have a lot of operational related complaints like long waiting time and they were not able to meet the doctor at the particular appointment time and things like that. So we did not have much clinical complaints, so that was a bit challenging. And also obviously being in a different country, there was a lot of cultural challenges that I faced. So in general, we have to prioritize the local crowd here. When there could be another patient coming from could be an expat who attended the doctor, but then the locals would not be really appreciated of that. So things like that were really challenging for me. But in comparison, clinical case complaints were relatively less.
So how far were your floor managers able to, or the care coordinators were able to manage the complaints?
Yeah, so they were trained to a certain level, and whatever that they could do whatever that they could do from their possibility, they tried, but they had their own limitations. Like I think in one of the session also I was speaking about the COVID test results. Here we do not have the test results being managed by the medical center alone. It was all sent to the government. So there was a lot of, especially when it started and things like that, and when they made it a mandate that everybody should carry a COVID PCR result for travel and those purposes, there were a lot of delays from the government. But our floor level managers were able to manage to a certain point that they could only say that the result would be ready by this particular time, or they would give them a call and things like that. But when it comes to me, then it'll be in a state where they will have the flight another couple of hours with the entire family traveling, and then they would not have the results in hand. So then I had to find in my own contacts and then try to send people around to go fetch the results directly from the government centers and things like that. So those were some of the instances that I could tell.
Yeah. Thank you for sharing your experience. Yes, Dr. Rekha, I think you wish to add something. Please go ahead. Yeah.
Yes, so basically I used to handle the situation in the OT as well as in the ICUs. And sometimes when the patients had the problem in the ward also, then I used to be called by the administrators also to be involved in all the situations.
Dr. Neha, hold on. So, Dr. Santoshi, have you joined from two devices? Because it's causing echo here. Yeah. Yes, Dr. Neha, please go ahead. Yeah. Dr. Neha, please go ahead. Dr. Neha, I think there is some network challenge at your end.
Am I audible?
No, you were not audible. Your video is also stuck.
Okay.
Mhm. Maybe you log out and log in, Dr. Neha,
Okay. Okay.
because your video is also stuck. So sometimes it
Okay.
happens.
So I'll leave and I'll come back again.
Yeah, that will be better. Yeah. So I think all of us in some or the other situation get an opportunity to handle complaints or request also sometimes from the patients and their family members. And although every one of us should know how to handle that situation, because usually by the time it goes to the higher level, the whole situation has gone sometimes out of hand. And especially those who are in administrative positions, they will agree with me that at times there's hardly anything left because we have already done the damage, and the patient or the patient party is already very upset and furious. So just one second. Okay. Okay. So normally, if we know how to handle at a at a primary level, if we empowered our staff to deal with it, in a more responsible way, most of the situations can be looked after. But then we need to really empower them with the right skills, right understanding, and right approach. I think that's very important, because the problem is every time patient says something or ask for something, we become upset and we kind of not, rather than cooperating, we start finding a way to teach the patient a lesson, especially if they have escalated the issue to a level where we feel uncomfortable. So I can share one case with all of you. There was a gynec friend of mine, and I'm talking about little. Maybe I've discussed this case about this gynecologist. There was a small time.
Yes, ma'am.
You remember that case? So
Yes,
imagine small request that the attendant had made, ma'am. Please, you do the dressing. I mean, she could have politely said that. I mean, dressing is done by nurses, but I will go and at least see the patient's stitches if it is healthy and if everything is okay. But she kind of, in a very little rude manner, she said that it's not my job and it's the nurse who will be doing, and the whole thing got completely, out of hand. And I told you that how for next couple of years she suffered the damage because of that. So that is the damage that it can make, and that is the importance of handling the complaints and the request that the patients make. So if I may ask another question to all of you, so what kind of complaints or requests do the patients or their family member normally make? You can write in the chat box. So what is it about usually the complaint? So I can see some answers coming and they're quite pertinent. For example, delay in meeting the doctor. If the waiting time is too long, they get upset and they complain. The regular complaint is post-OT update or ICU update. Yes, I agree with you, because usually they are very concerned about the patient's condition, and we do the updating in our regular manners, and actually they can be very anxiety provoking for them. Then Dr. Manisha says it's about sisters not turning if they are called. Yes, again, if the sister doesn't go promptly, they kind of consider that they are being neglected. Dressing concerns, yes, if it requires dressing. Patients want to result in long chronic disease also. Yeah, but then that would not be like a complaint or a or a request. It's more like their expectation. I understand what you're saying, but it's more like, their expectation that they look for quick result. Then food not served on time. Yes, that's also a common complaint. And not satisfied with the doctor's treatment. Yeah, especially if the doctor hasn't been very cordial or good to them, so they kind of they can be annoyed about it. Then post discharge instructions, especially if it has not been given on time and also not given clearly, they can be complain about it. Then they complain about the change of room or delay in treatment or delay in services. Yeah. Again, if the room is not in good condition, so they can complain about the room is not in good condition. Toilets are not clean. That's also very common complaint we get to hear. And then also if there is delay in any service, they would complain. Then doctor visit is delayed. Yes, even that's a common reason you get to see. Poor bathrooms, poor room. Yeah, Dr. Sneha, I think this is what I was saying, and you have also mentioned the same. Doctor not explaining after procedure. Yeah, a lot of time they are unhappy the way they are, given the update or they are explained. They feel that not enough has been explained to us, or their questions have not been answered, or their concerns have not been addressed. And most are after the surgery. Yeah, especially after surgery, they expect proper update and explanation. And in case if there is some complication or delay or whatever, they want more understanding about it, no doubt about it. Then not getting enough time with the doctor. Yes, that's another complaint you will get to hear when doctors, do a hurried kind of a visit if they are visiting the patient, or when the patient goes into their room and they don't give enough time, they feel the wait and the fee was not justified. Uh, Quite. Yes, rude receptionist and rude staff also sometimes. Security staff sometimes are rude. General duty staff are rude. Sometimes nurses are rude. Receptionists are rude. So they would definitely complain. Then consultation fee or treatment charges are very high. At times they do make a mention. Just to mention here, somebody known to me got her bridge fixed here in Delhi, and then she went to get her bridge. In Bangalore, her bridge got dislodged. So she went to the nearby dentist to get the, bridge refixed. She didn't ask the charges to start with. She said it's just a very small thing. So naturally, it's just a matter of putting the material and fixing it. And after she did, after her bridge was, replaced, uh, and when she asked about the charges, she said 3,000 rupees. So you can well imagine how patient must have felt, especially if it appears exorbitant, they are likely to complain. Then housekeeping issues, yes, that's a very common complaint you will get to hear, that they are not getting timely service for the housekeeping. Delay in reports, daily updates about patient's improvement, delay in referrals. Yes, what to do if the patient insists on what you have done is wrong and goes on complaining? What to do if the patient insists on what you have done? Dr. Aparna, I think I will request you to unmute and explain what exactly you want to ask or say. Yeah. Please unmute your device. Or maybe your device audio is not connected. I can't see the mic on. Yeah. So by the time she fixes, yeah. Yes, it's not audible. It's not connected, Dr. Aparna. You will have to actually, yeah, try once again now. Maybe it works now. Yeah, try speaking now. No, you will have to log out and log in. And when you log in, please connect the audio. It asks what audio you want to use. So you'll have to say device audio. Yeah. Then insurance pre-approval delay. Yeah, that's again a very common complaint they will have. Then visiting hours, especially if they're coming, beyond visiting hours, so they want to visit the patient and they can be annoyed about it. Yeah. Multiple pricks with, yes, tracking sample. Yes, that's also very common. Discharge delay, again, a very common reason for patients becoming angry and annoyed. Directions to different departments not clear and uncoordinated working of different departments. Yes, that's also one of the reasons. And then when patient gets a different second opinion from another doctor regarding the treatment plan proposed, again, it will not come as a complaint, but it may definitely come as a reason to be annoyed with the doctor, or a question that they expect the doctor to answer, that why is my your findings and the other doctor's findings are different. And if they don't get a very satisfactory answer, definitely they get annoyed about it. and then going to different counters during discharge for different kind of places. That can also be very annoying to them. So I hope, Dr. Kundan, you know what we are discussing. You have an idea what we are discussing?
About complaints of the patient?
Yeah. So we are trying to understand what are the common kind of complaints you get to hear from the patient or patient party. So if we may broadly categorize these complaints, they can be around, 4 or 5 major issues. So one very common one is staff behavior and attitude. So if they see the staff, either the receptionist or the nurse or the general duty staff or the housekeeping staff, if they are not very, cordial, not very helpful, so they may go and complain that this receptionist is very rude, she's very misbehaved. That's very common. Second common complaint you will get to hear when they have patient safety issues or the environment is not hygienic. For example, if the bathroom is not clean, the bed is not comfortable, sheet is not clean, if that's the reason, usually they'll have complaint about, cleanliness, or if there's a fall because of the, maybe wet toilet. So they make it very, very annoyed that nobody cared to dry the, toilet and my patient actually fell. Third common complaint they will have is about communication and information. So when they're looking for communication from the doctor, from the nurse, from the receptionist, from the, from lab, and if that does not come promptly, they get annoyed. They feel that, nobody's caring for my patient. That's a very common. Or when they want to speak to somebody and that person is not there to, respond to them, that can be, one of the reasons. Then a very common, complaint could be about billing, especially if they feel that there's a discrepancy, or if they feel that they have been excessively charged, or they have been charged for something that service was not provided, or double charges. So again, these are quite, pertinent issues for which they complain. Especially, for example, if there's lack of transparency in billing, they feel that they have been cheated or they have been overcharged. These are the common complaints they will have. Of course, some of them will have also concerns about the medical care, where they will actually not be satisfied with the way the diagnosis was made, or there was a delay in diagnosis and delay in treatment. Or if they can forthrightly see there is some kind of error, there is some kind of medication error or treatment error, then of course they would be very unhappy and they would want to go and complain to whomever they can complain. So these are the common, reasons you will come across. And I think each one of us should know how to handle it. I'm saying this because earlier we are able to handle, I think, better positioned we will be in managing the situation. And more we try to delay the handling, more complications, more problems, more challenges you are likely to see. So if I may ask you, what do normally the complaining party wants? Write in the chat box, what do you think the complaining party wants? When they complain, what exactly do they want? Santoshi, are you there or you're occupied with your presentation? Unmute your device.
No, ma'am, I'm here.
Madam, I cannot. I don't know what's happening.
Sorry, I couldn't get.
I'm not able to listen anything.
Oh my goodness. Acha. Join from your mobile phone. Yeah, we can see you now. There could be a major network issue at your end. And if you want, you can join using your phone in case if nothing is working. I think, Mamta, you are also traveling.
Good evening, ma'am. Yes, ma'am, I'm traveling on some emergency.
And a lot of issues I'm sure you must be handling with being, nursing personnel, you would know.
I've been listening, ma'am. I've been listening.
But I would request you to reply in the chat box in case if you're not able to speak, at least write in that will be really good for you. Yeah. So I can see
yes,
some.
ma'am.
Yeah. Dr. Priya, can you mute your device? Okay. So looking at the answer, like what do normally complaining party wants? I think Dr. Amrit says they want clarity. Okay, that's true. Dr. Sneha says they want acknowledgement. Yes, I think that's a very important thing, Dr. Sneha. a lot of time we don't even acknowledge that your complaint or your request is justified or is worth attending. Especially if patient comes often complaining about something, we kind of get irritated and we say, what is this? You are complaining or cribbing for very petty things. We give this kind of reaction and that further aggravates. Of course, they look
Yes,
for,
ma'am.
yeah, they are
The
looking.
one point is few patients always complain that they don't get discharged early.
Yeah, that's a very common complaint, and we'll talk about it, how actually this whole thing can be handled effectively. Then they want to be heard. Yes, Aditi, I completely agree. Somebody please listen to me. Somebody please listen to my problem. Somebody please allow me to tell what is bothering me. Absolutely. So they want to be heard. Then they want things to be properly explained. So that means, please, somebody, like for example, Mamta is saying that they usually have grudge against, not getting discharged on time. See, the moment consultant says discharge, patient thinks it's just 5 minutes thing. I just have to get my paper and get out of the hospital. Whereas we know in the background, there are so many things to be done before we actually can discharge the patient. Especially if the patient is under cashless, then you have to get clearance from TPA. Then we have to make sure that all bills are lined up. Then you have to submit all the bills. Then you have to make sure everything is in place. I mean, there are a number of things that it virtually takes almost 3 to 4 hours minimum. But nobody explains this much to the patient. Okay, I'm saying discharge, but the discharge procedure takes almost like 3 to 4 hours. So if I'm saying discharge, you can expect to be discharged by 6 o'clock or 5 o'clock. That means patient would know, okay, even if the doctor has said 12 o'clock your discharge, the whole procedure will take, they may ask why so long. So if we explain that this is the reason why it will take long for you to get discharged, they will understand. But we don't do that communication. And I
Yes,
think
ma'am.
that
I remember your last week point, ma'am, that and if the nurse is there, she has to counsel the patient before they get discharged so that they'll be mentally prepared. It will take some time. And the other complaint always is that patients wants always doctor to be there for them whenever they feel like having, even if for small pain, they want doctor has to come and address them. This is the usual complaint we.
So again, communication, explanation will help here. Telling them that, see, they are not free like this, that they are sitting at a place, they are busy with another patient. So they normally come around, or we have a resident here, and if there is something urgent, we always inform them and they give us instruction on phone. So that means that process has to be explained to them, and I think that is what is required. Okay, then Payal says that they should be heard. Yes, I agree. I think this is something everybody is saying. They want solution, they want alternative option. Absolutely. So if somebody is listening to them and if somebody is offering them some solution, they at least have this feeling that, okay, somebody is trying to help me out in this situation. Then they want someone to hear their complete story or complaint patiently, speak to the authority in a responsible manner, and also they want quick resolution, sometimes discount in the bill. I agree with you. Again, when they ask for discount or waiving of the charges, how we handle the whole complaint situation, which we will learn now when we will do the role play and also do the discussion around it. See, we have to very clearly tell what is doable and what is not doable. If patient is expecting that I can bargain on this, or I can twist their arm and get the discount or ask for waiver, and if you know you haven't done anything wrong, and if you are clearly able to spell it out, usually they get to know that this is not going to work. A simple example of this is when we go to a shop to buy something and we say, what is the discount? And that person says, I'm sorry, there's no discount. And you say every shop is giving 10%, 15%, 20% discount, and you are saying you are not going to give any discount. And that person says, ma'am, others have actually, overpriced their product or their item. And then they're giving you discount. We have reasonably, priced our item, but we don't offer any discount. You are more likely to trust this person because he's telling you very clearly that neither I have overpriced nor I have left any scope for discount. But the moment he says, select whatever you want, let's see how much discount I can give you. So there, 5%, 10%, 20%, you would further want more and more discount from them. So again, how you handle that will decide whether they will bargain with you or not. Then they want transparency. Yes, that's one thing that they want. And unfortunately, our way of functioning, not that we deliberately are not transparent, but we are invariably not transparent. And that is assumed that we are deceiving them or we are cheating. It may not be a deliberate kind of a, but that's an inbuilt, probably the
Ma'am,
dysfunctional, I would say, feature of our function. And we have to particularly see how we can make it more transparent so that they, like, for example, now, every hospital is expected to have a rate list put, right at the inception. So that is to bring transparency. If the patient thinks I can't pay this, they will not go to see the doctor, but they will not otherwise complain. Like, for example, this doctor who charged 3,000 rupees just to fix the bridge. I mean, I'm sure she must have not put those charges. This patient who paid 3,000 rupees, she could have actually told this doctor clearly that you have not displayed the charges and I will not pay you 3,000 rupees. But I think out of hesitation, she paid 3,000, but she came back and she was scribbling, later to me. Okay, then they want some action to be taken about the complaint. Then they want to be assured that, reassurance that that everything will at least now be taken care of. And even if something went wrong, that has happened in the past, but we will take care in future. And they want senior doctor in charge of the case, because if it is a very serious thing, then they expect somebody senior to come and handle the situation. Then wrong precedent make patient anxious and not trusting. Yes, that's possible. And they want the feedback on any action taken if something has gone wrong by any staff. Absolutely. I think we have covered most of the points, and this is what I heard in my mind, that usually they want to be heard. Then they want to be taken seriously. If somebody listens to them, if somebody, gives them that space where they can talk about their problem, that satisfies them that, okay, somebody is ready to, talk to me. Then they expect to be treated with respect. If we are making them run from pillar to post, go to that room, go and meet that person, I'm not the one who's going to handle. If you make them run from place to place, they are more likely to feel, humiliated, and then they can become furious about it. Then they want immediate action, whatever their request or complaint is, they expect somebody to help them. Sometimes they also ask for apology. Ask that person to come and apologize because this person really, really misbehaved with me. A lot of time they will come and tell you that this person has to apologize. By the way, how would you handle if that person says, okay, call that nurse and ask her to come and apologize? Or call that receptionist or that gender duty staff and ask him or her to apologize? How will you handle this? Will you call the person?
no, ma'am.
Then how will you handle?
Ma'am, so there was a scenario in our hospital, and being in the administrative post, it was a pediatric patient, who was shifted, a girl child,
Mhm.
who was shifted for a minor procedure PIC line from PICU to the ward. Although it was a maternity area, but because there was a shortage of, and they applied for a single room, she was shifted in my area. As I mentioned that because for the PIC line, they had to, the sister pricked the baby 3-4 times. The mother got very furious and she shouted and asked the sister to get out of the room. In between, when the baby was crying, she aspirated. They had a suction, a pump of their own, and the mother knew because the child had some issue from birth, and she started suctioning. I came to know it happened in the midnight at 3 or 4 o'clock. In the morning, when I reached at 8:30 a.m., I came to know that there is some problem on the floor. So I went and tried to speak to the mother. She also asked me to get out of the room. She just told me, shut up and get out. I don't want to talk to you. I was very calm at that point of time, and I just saw what was happening, how the family members and she was handling the baby. She was very, very caring for her baby, very protective, and she had lost trust on each and every person in the hospital. And she said, I want to take my baby Lama from here.
Mm.
I tried to intervene very calmly. First, I tried to speak to her husband. Her husband was little supportive. He came out and listened to me. I said, see, I will call an anesthesiologist who will do the procedure very calmly and no, oh, let's give the medicine what is required for the treatment of the baby. We should not stop the medicine what is required. I completely understand that you want to take the baby from here since you don't trust us anymore. And I'm very sorry. I said these words that I'm very sorry, although it was the nurse, but I apologized and on behalf of my staff. I said that I am very sorry that it has happened and I will take care and ensure that it will not be repeated. So please allow me to call the anesthesiologist who can take care of the whole thing and the medicine can be given. I also called the treating doctor to explain them that it is not something very something very big which has happened, which has caused any harm to the baby. But yes, we apologize for the multiple prick. It should have not happened. The mother was not ready to listen at any point. She came out of the room and said that nobody is going to come in the room. If anybody comes, I'll call the police. So I called my nursing in charge and no, we tried to speak to her. And then I said that, ma'am, I understand you. I'm also a mother and I completely understand no, your worry about your child. Just allow us to give the medicine. You can take the patient Lama or you want to get her discharged or you want to keep her, we'll decide later. I completely and totally understand you. Give me 5 minutes to make you understand what we are going to do. If you are okay, we are going to do. Otherwise, we'll proceed for the discharge procedure. She listened to me calmly. She allowed us to give the medicine which was needed to be given at that point of time, ma'am. She took the baby Lama. The baby had aspirated. Even after she left the hospital, I was continuously in touch with her. And she came back after 1 month and she contacted me. And she said that I'm coming because you were there to support me. And she gave a feedback to the management that it is because of Dr. Manisha I have come here for the procedure which was planned at that day. I didn't ask my staff to apologize, but I apologized as a senior person over there. And then I asked my staff, then we did the RC, what has happened.
So thank you so much. I think you have actually given more details than I had asked for, but thank you for sharing your experience. And I think that you have showed that if you are able to, professionally handle a situation in a responsible manner, you can actually reverse the situation and you can win your patient's trust. I think that was a wonderful example that we shared. Okay, now going back to the main topic that I was saying, that as patients would normally ask you to call the staff who has done this damage and they would ask you to, ask that person to come and apologize. I think usually it is not a very good idea to call the person and to make that person apologize because one, that person's morale can go down because that person will feel embarrassed and humiliated in front of others. And also sometimes the patient party can become so aggressive that they can become violent and raise their hand or maybe even hit the person because they know that okay, this person can be physically also hit. And there are cases where they have done it. So it's always not a good idea to call them. Maybe you can say that I understand that you're very annoyed, but calling that person is not going to help because that's going to cause further complications. As Dr. Manisha said, that if you apologize on her behalf or his behalf and say, I'm ready to apologize and I understand the damage that you have suffered, I'll definitely work on it. I'll speak to that person directly and I'll see how that person can be, made to realize that it was not a small thing what you have done. But never bring them face to face. I think that's the message I want to give you. Never bring them face to face. It actually aggravates and it can actually do more damage than doing good. That's the message that I want to give. Yeah, for example, sometimes they ask for compensation. That's also one of the, desire they have. Again, if some damage has been done by us, honestly, actually, we should be compensating. For example, during surgery, if we have done something and the patient has to stay for longer or patient has to undergo another procedure because of our error, I think then responsibility is ours, but then usually we try to escape that responsibility and we put it on the patient. Earlier, patient tolerated it, but now they can go to any extent to create ruckus at your workplace. So again, it's not a very safe game. But then again, a lot of time, even when things haven't been, done wrong by you, and sometimes they ask for compensation, we have to really pick our battles. There's no one line word that don't compensate, and there's no one line that says don't compensate. So you have to really evaluate which is less damaging. Then probably you would not, then you would choose out of the two. And then, of course, sometimes they would want that person to be punished or reprimanded. Again, do it, but not in their presence, because that's something is not going to be helpful. And then they want assurance that, it will not happen again. So you have to really demonstrate and show that, okay, whatever has happened will not happen again, and you will make sure how that happens. Dr. Neha, do you wish to say something about it?
Yes, madam.
Yeah.
Talking about if something has gone wrong, definitely
Dr. Neha, maybe you can switch off your video.
compensate.
Dr. Neha,
But you said,
Dr. Neha,
complications do occur, and
Doctor-
beforehand also that these are the complications. Now, as you said, hello.
Dr.
Again,
Neha, hold on. Your video, switch off your video and try speaking. Otherwise, join using your phone, because there is major network issue at your end. Yeah, maybe now you can speak.
Am I audible now?
Yeah, it's better now. So you can keep your device on the mute mode. Sorry, video off. Actually.
Video off.
Yeah.
So, as you said that one has to really weigh, I mean, whether to really compensate or not compensate, because many a times it also happens that there was no fault of anyone and some complication has occurred. And if somebody offers to say, okay, I'll let go of my fees, sometimes we've seen that a negative impact goes. The patient start thinking that they have done something wrong. That is why they want to leave all the money. So that also we have faced. So as you said, one has to really judge how to go about the things.
Yeah, I completely agree. So there is, as I said, there's no one-line answer to it. You'll have to evaluate the situation, weigh the pros and cons, and then go ahead with whatever decision you have. So if I may ask another question to all of you, should we encourage complaints? Are they good for the organization?
Yes, madam. I would say we should, because at least we come to know where we can make the improvements.
Yeah, so that means if we are of the mindset where we want to improve our way of functioning, then definitely these complaints will give us a feedback from the patient that these are the areas where we have lacunas and we need to, improve our functioning. Dr. Kundan, you wish to say something? Go ahead, please.
Yes, I do agree with encouraging complaints. I will tell my experience. I'm working in a corporate hospital as a consultant. So what I have seen is encouraging the patient to give feedback is good. But sometimes too much of what I saw, like patient relationship manager, the PRO, the superintendent, every 1 hour, 1 hour, 2 hours, these people they visit the patient and they ask, you have any problem? Do you have a problem? So sometimes too much of communication in that regard. Sometimes then patient starts to feel that it is pampered like a 5-star hotel. So unfortunately, this is not a case. So many times what they also have to realize the difference between a 5-star hotel and a hospital. So I think getting complaints, getting feedback is essential, but too much of that I think is counterproductive. In many cases, what my experience suggests.
I completely agree with you that we don't have to overdo anything. But usually we don't like having complaints. And even if somebody comes complaining, we are not very receptive to complain. Even when they come back with the feedback, we are not very open to the idea of receiving the feedback. Let's be very, honest about it. Yes, in random cases, like you're saying, if too many people go and ask the patient party, are you all right? Is everything okay? Is there anything I can do for you? So naturally they'll feel, okay, now I've been looked after by them because probably they have done something wrong and now they're apologizing. Of course, that's one of the less common kind of a situation, but more common is that we are less likely to, listen to their complaint. But very honestly, if you allow the patient to complain and if you listen to that complaint, see, in first instance, if there is something not being done, they will be unhappy. But if you listen to their complaint and you resolve it, then probably the anger also goes away. And also at the end, they're loyal to you, because ultimately they feel that you have done you. I think, did I share that experience when I came from US? My 3 bags got damaged. Did I share that with you? No, I have not shared. So this time when I was coming from US, out of our 4 bags, 3 bags got damaged, in transit. One bag was completely damaged, like it was broken to pieces, you can say, and it was brought in a big that plastic carrier. It was brought in, and 2 bags were damaged because their wheels got completely damaged. In probably they were throwing it or what they were doing, I don't know. So when we landed at the airport at Delhi, and they brought that bag in a blue carrier, I was shocked to see. I said, "What has happened to it?" It was broken to pieces. Thankfully, nothing was lost in that. And then 2 other bags, when I tried to pull from the belt, they were not. They were literally falling on the other side. So I got realization that all 3 bags are damaged. I went to their complaint counter and I said, "Ma'am, 3 of my bags are damaged. So what next?" So usually earlier when it happened, you go to the counter, they will either give you a replacement right then and there, because they'll have a stock of, stock of bags, which they will give you as a replacement, or they'll maybe give you a complaint number that, okay, we'll get in touch with you, or somebody will come and replace. This is what earlier we have. So this time she said, no, you have to, go online and complain and also put the images yourself. So I said, I can't do that. And how, once I take the bag away from here, then how will you make sure that these damages actually happened here? But she said, I'm capturing the pictures, so I'm holding the pictures with me, and I will also be uploading the pictures from my side with your ticket number and everything. But you also have to do the same. I trusted her. I came home next day, or maybe second next day. I sat with the pictures of all the bags, and then I uploaded the pictures and I did the complaint. Within 1 week, they kind of corresponded with me through email. Couple of things they asked, which I replied. And then within 1 week, they said, okay, this is the amount we are transferring to it. Now, if my complaint has been heard in a very professional manner and they have sorted it in within limited time, I think I am not annoyed with them. Had they made me run pillar to post, take your bag to falana repairer person, get them repaired, show it there in case if it can be repaired, they will repair it for you. Or otherwise, if it is beyond repair, then they will give you another bag. I would have been very, very furious. I think now we have to understand, if we have to stay in business, we have to learn to handle these complaints and these requests in a very responsible manner. Earlier, what we thought, we are the Rajas. Person who is taking our services is at our mercy. That's no more now. That's no more. So if I tell you, complaints will be there, whether you like or not, complaints will be there. I think how you handle those complaints will decide whether your patient will be happy with you or not. But definitely, I think complaints is the second chance to repair the damage. And once you are able to resolve the complaint, you earn your, patient's loyalty. And also, when you don't attend to them, then you are, calling for problem, and it can actually do a huge damage to your reputation. It can also cause financial damage to the organization. As very rightly said by many of you, that more you get to know about the complaints, more lacunas you are able to identify. So that's a wonderful opportunity to, improve your services. How many of you read your patients' feedback, especially after they go and if they give any negative feedback, and you take it seriously and then you try to work on it? I think that is one wonderful way to improve your services. So once you get the feedback that this was not okay, and if for that particular thing, if 2, 3, 4 people have complained, that's an alarming sign that means there is something very serious and I need to really, do something to it. So I can see an answer. Dr. Priya says, I always take both IP and OP feedback. I agree, Priya, we all take feedback, but we need to take that feedback seriously. So when we go for NABH assessment or for NHSRC assessment, we ask them, do you take patient satisfaction, patient feedback? Oh, yes, it's 100%. Patient feedback, all satisfied, 5 out of 5. That's not feedback. I think the kind of concerns they have, are we really attending to them? That's very important. Now, what is the risk if we do not address these complaints? What do you think can be the damages if we don't resolve these complaints? Now, Santoshi has written that we do document RC and CAPA to complain. I think that's a very good idea. Okay, bad reviews. Yes, Dr. Amrit, I agree with you. I think Google is the next thing. So people don't hesitate going and writing bad reviews for the hospital or even for the doctors. Sometimes directly they will name the doctor. Yes, loss of trust, reputation, loss of patients also. Litigation is another problem, no doubt. Risk of litigation, risk of negative reviews, social media propaganda, bad word of mouth. Yes, loss of patient trust, bad mouthing, litigation. So we all know, and ultimately it can actually, boil down to reduction in the football, closure of the system. We have even seen this happening. If your reputation goes down beyond a point, people stop visiting you and they kind of believe that, okay, it's not worth going. We'll spoil reputation and loss of business. Yes, that's what exactly we are saying. So, of course, and that will have a very, damaging effect on your team's morale also. Your staff, they will be very unhappy and professionally very dissatisfied with you. Of course, there's a risk of litigation, risk of violence, aggressive reaction, which we cannot, ignore, which is very, very serious. And Dr. Priya has written, we have TAT. What is TAT, Priya, if you can unmute, for feedback closure? And then team connects and
We have a policy
Turnaround time.
that we close the feedbacks. We do call back and connect with the patient, understand what had happened.
okay.
And if that's a misunderstanding, we try to explain.
Okay,
and
turnaround time. TAT is turnaround time. Oh, I
Turn-
get it. Yeah. So I thought, okay, now I get it. Yes, thank you. So exactly, I think if you know that, okay, in this much time we have to close this, that means it's a very prompt kind of so let's do a small role play around one situation that you would like to, watch somebody do the role play. Any situation you have on your mind? It will be nice if you bring up a situation which you have dealt, but you think I couldn't do it, couldn't do enough. It could have been done in a better manner. Then I think it will be a huge learning for all of us. Anybody who would like to share their case? Not done by you, maybe somebody else who managed, and you think it was not managed well. We could even take that situation. Not necessarily that you have faced the situation. Any case, any situation? Something difficult, something. That is why I wrote in the group. I said, please be mentally ready with some situation. So no situation? Everybody.
Ma'am,
There were multiple situations, but I mean, I can tell the things like one of the
Dr. Neha, you will have to shut up with you.
and
Only then we will be able to hear you.
ICU.
Dr. Neha, your video. Yeah.
Sorry.
Yeah. That's okay.
Is it okay now?
Yeah, you're audible now, definitely.
Am I audible now?
Yes, Dr. Neha, you're audible.
There's something really bad today.
So anybody else?
Am
if
I
you,
audible?
Dr.
Ma'am?
Neha, you are audible. I'm not sure if you're not, if you are not, probably you're not able to hear us, no?
I was not able to hear you. But
Are you able to hear now?
Yes, you can.
Yeah, you were saying
Actually,
something.
yeah, there was one patient, brought into late evening and put on ventilator. But unfortunately, because patient was quite sick and in the night and the neck Yeah, but the next day in the night, the patient expired.
Hmm.
And in the early hours, I mean, we came to know that a lot of hangama and everything, you know.
Mm.
So actually, this was very difficult situation. Early, I reached early there,
Mm.
and at that time, and the patient's son was very angry,
Hmm.
and I came to know even he slapped the doctor. Then, I mean, the doctor on duty.
Hmm.
Uh, so, and there were lot many patients relatives outside,
Hmm.
so I called them into the counseling room and discussed with them.
Hmm.
But definitely there was no fault at the, I mean, anybody's end, but since they again and again the son was saying we came walking,
Hmm.
meaning walking in the sense they had come in the emergency, and
Hmm.
she was actually in septicemia and very sick. But
Hmm.
their point was she was, I mean, okay types, meaning she was talking, but since she had to be put on ventilator, so naturally she was not then in a state that she could have talked, and then within one day she expired.
Hmm.
So this was a very tough situation to handle. They
Hmm.
were very angry, but somehow, I mean, probably I was a lady, so probably they did not do anything with me.
So, Dr.
But
Neha, hold on. If I may please interrupt you. Again, this is not a fit case for having role play for managing complaints.
yeah, but
What
this
I'm
is a
looking for, see, this could be, breaking bad news, and this
yeah,
is a aggressive reaction, or this could be a fit case for a discussion around aggressive patient party. How do you
yeah,
handle
you are
such
right.
people?
You are
I
right.
request, I think let's stick to the point. I am looking for some case, and if you don't have, then maybe what we'll take a,
Ma'am, can I share?
okay.
It's a
Okay.
small incidence actually. Maybe we
Please
can.
don't share the incident, Dr. Manisha. What I'm looking for is this situation so that we can do a role play. Because if
Yeah,
you start discussing the what you did, then we have the answer. But I want everyone to think how could have that been handled. So
no,
just share the situation if you have any
okay.
situation. Yeah.
Yes, ma'am. It is the situation only.
Okay.
Yeah. So, ma'am, it is during the COVID time. This
Mhm.
was a 5 months pregnant lady who had come in the OPD to see a senior consultant.
Mhm.
She had mild fever since 2 days.
Mhm.
So at home, she was taking some crocin and home remedies.
Mhm.
So she didn't call the doctor, and all of a sudden, without testing that she is COVID positive or not, she came to the OPD
Mhm.
and to meet the doctor during
Mhm.
her OPD time. As soon as she came in the OPD, she told the coordinator that she would like to meet the senior consultant.
Mhm.
And the coordinator should give her priority because she is having some mild fever.
Mhm.
The coordinator through intercom conveyed to the doctor that no, so and so person has come to see you and she is having mild fever.
Mhm.
The doctor came out and started shouting on the patient that no, why you have come in fever, you might be COVID positive, यहाँ पे सबको बीमार कर दोगी तुम. And then the scenario happened. So how we can, I mean, take it as a role play, how we could have handled it.
Did they complain, or did they
Yes, she complained because she was actually a booked patient. She didn't come to deliver with us, and she was a high profile patient. So they made a complaint that the doctor misbehaved.
Okay. So do you think we can take this as a role play situation?
Ma'am, about the behavior that how
Behavior.
the,
Okay.
yeah,
That's
if you think I have just
No,
told
no,
you
it's
about
okay.
it.
It's all right. It's all right. I was thinking that we could take some service related situation. For example, somebody has come for MRI. The patient is in actually very critical condition, and that patient has to undergo, surgery, neurosurgery in the next visit. But unfortunately, the MRI machine has gone out of order. And now the family is very, curious that we had taken appointment, we have come all the way, we have brought the patient in ambulance, and now you're saying the MRI machine is not working, and then we need to, now where do we go and when will the surgery happen? I mean, I was thinking something like this we could take. Dr. Kundan, you wish to say something?
I had one patient. I think she's a young girl admitted in ICU, and she was very furious with the housekeeping staff. Apparently, she had, I think she had urinated. So the housekeeping staff, apparently, according to patient's version, told that housekeeping staff told me itni badi hoke bhi urine bed mein hi kiya, because she had to clean. And because of that incident, that patient was making a lot of complaints and cry that I want to get discharged from this hospital immediately. She was happy with the clinical treatment. She was fine also. So that was a difficult, maybe a situation which, how to handle that situation where the housekeeping may not, we were not knowing the data, but she was getting wanted discharge only because of that misbehavior of the housekeeping staff, apparently.
So if you wish, we can take this case if you think you want to work on this case, because definitely if they wanted to go, like for example, Dr. Manisha said there was a mother who wanted to take the child, and then she could talk to the family and help them understand. So she could take the attention of the family to the welfare of the child. If you saw Dr. Manisha's approach, she took the whole focus on what is required for the child, and everything else was secondary. She said, even if you want to discharge or if you want to go Lama, you can take Lama, but then the care should not suffer. If the patient needs to be given medicine, patient should be given medicine on time. And then if you want, you can take the pill. So I think she demonstrated that she could strike conversation. Do you think that is something difficult, and you would like to see how others handle that situation? Okay. So maybe I'll request any one of you to be the doctor on duty. You could be the patient's treating doctor, and then I want somebody to play the role of a patient. Anybody who wants to be the patient play the role of patient. So Dr. Kunal, I would request you to be the patient, because you know the patient's behavior and communication that she made, and whatever points she was making against the housekeeping staff. So anybody who would like to volunteer to manage this situation? See, it's only through role plays we learn. We get to also understand that we say it's easy, but actually it's not that easy. Anybody?
Ma'am, I can try.
No, Dr. Manisha, hold on. Aditi, would you like to handle this situation? You are managing hospital. I think you're managing your parents' clinic. So,
Right.
so I'm sure as an administrator, you must be facing some situations where you have to handle.
Most of the same situations I'm facing, most of the same situation regarding the sweeper staff. He has done this.
So I
She has
request
done
you
this.
to be. I request you to be the doctor on duty, treating doctor. You are the one who is treating this patient, and Dr. Kundan will be the patient. But of course, it's a role reversal. Dr. Kundan is playing the female patient, and you are playing the male doctor. But that's okay. I think that's not a big thing. Dr. Kundan, what was the case, if I may ask you?
I think she was a case of. I think she was a case of pneumonia. She was being treated well. She had some hypoxemia, but then she was on the recovery path. We might have discharged her within 48 hours, next 48 hours. And this happened on a Sunday. We had sent her to some, I think, CT scan or CT scan. And there she, I think she voided. And then according to her version, the housekeeping staff told her that this sentence, "Itni badi ho ke bhi aap bed pe urine kar rahe." And that she created, not a scene or whatever complaint, but she was fine till that day. She was absolutely good patient. She was happy with our treatment, and we were in a dilemma what to do with. Apparently she had a bad experience with the housekeeping staff. Should we own that, or we should we counsel her, or and asking her to take Lama also. She didn't want Lama for the treatment sake. She wanted that I would not stay in a hospital where she was misbehaving.
How old was the patient?
She was 26-year-old, and apparently she was not married. Her boyfriend was with her. So I think she had a lot of, she took it on the ego, or maybe
embarrassment, maybe more of an embarrassment.
Embarrassment for her. And then
main complaint was against the lady staff.
Yes, lady staff.
Male staff.
Not regarding the treatment.
Usually the female patients are handled by the female housekeeping staff. Yes. So it was a female house. She was a female housekeeping staff.
So the main complaint was against the housekeeping staff, not against the doctor or any treatment.
But then she wanted discharge for that reason only, and she was very adamant on that.
Although again, this is a case of llama, not fit for this particular case that we are handling. But I think we can at least say, how do you handle those complaints? If she has come up to you, okay, she's not asking for llama, but she's complaining to you that your housekeeping staff has said me like this, and it's very embarrassing. And how can they talk like this with the patient? So let's see, Dr. Kundan. We'll all switch off our videos. Only Dr. Kundan and Dr. and Aditi
Can I
will be.
speak in Hindi, because I think Hindi would be more effective, or English also is fine. Whatever as you suggest.
Aditi, how are you comfortable?
Both. Hindi is okay.
Hindi is okay. Okay, I think we'll have a more, more interactive session, I can say, when we have, yeah. So both of you, imagine that you are playing your role. Go ahead, please.
What is the name of the patient?
Name it was some before COVID. I forgot. Maybe
No,
name Sunita. Maybe Sunita.
Make it take a name.
Sunita. Yeah.
So hello Sunita. I heard you had some complaints regarding the housekeeping staff.
नहीं डॉक्टर साहब, नहीं, मुझे डिस्चार्ज ही चाहिए. आपकी हिम्मत कैसे हुई, आपके स्टाफ ने मुझसे ऐसे बात की?
सर मैम आप बताओ तो दिक्कत क्या हुई है, फिर मैं
क्या बेड में रोज यूरिन करती हूँ. मैं ऐसी इतनी बड़ी हो गई, मुझे समझ में नहीं आता ये क्या बोल रहे हैं. ऐसे कैसे बताया मुझसे? आप कैसा आपका हॉस्पिटल है? नहीं, मुझे अभी डिस्चार्ज दे दो आप. मुझे नहीं रहना इस हॉस्पिटल में.
मैम इट्स ओके मैम, गलती हो गई मेरे स्टाफ से. मैं अपने स्टाफ की बिहार पे सॉरी बोलती हूँ. आप अभी ठीक हो?
आप क्यों सॉरी बोलेंगे मैडम? आपने थोड़ी ना बोला है मुझे. आप तो मेरे से अच्छे बात कर रहे थे. आपने मुझे अच्छा ट्रीट किया.
मैंने आपको बहुत अच्छा ट्रीट किया ना सर. मैं अपने स्टाफ के बिहार पे सॉरी बोलती हूँ. She will not do the same thing again with you or with any other patient.
नहीं, ये तो ठीक नहीं है मैडम. ये आप ऐसे किसी से कैसे बात कर सकते हैं? मेरे से आज से अभी किसी ने ऐसे बात नहीं किया. आप सुनिए मैडम, आप नहीं सुन रहे मेरी बात.
आप बिल्कुल सही कह रही हो मैम, आप बिल्कुल सही कह रहे हो.
मैडम सुनिए मेरी बात.
हुई है. I'll look into the matter कि उसको क्या पनिशमेंट दी जा सकती है, क्या करा उसने, क्यों नहीं करा. I'll look into it. आप इतना हाइपर मत होइए. आप अभी ठीक हो रहे हैं, धीरे धीरे रिकवरी साइड पे जा रहे हैं, और आप ऐसे हाइपर होंगे तो आपका बीपी बढ़ सकता है और दिक्कत बढ़ सकती है. जो आप इतना रिकवरी साइड पे तो क्यों डिस्चार्ज जा रहे हैं? बिकॉज ऑफ वन हाउसकीपिंग स्टाफ. उससे मैं बात करूंगी. अगली बार से आपके पास वो नहीं आएगी. अदर स्टाफ विल कम एंड शी विल टेक केयर ऑफ यू वेरी वेरी वेल.
नहीं, मैं तो बहुत, मुझे बहुत फील हुआ है मैडम. ऐसा नहीं होना चाहिए ना कि जो मेरे साथ हुआ है.
मैं समझ सकती हूँ. मैं आपकी सारी बात समझ सकती हूँ. मैं आपकी जगह होती तो मैं भी वही फील करती. लेकिन आप मेरी बात भी समझो. आप अभी रिकवरी साइड पे हो. अब आप डिस्चार्ज चाहते हो. अगर 2 दिन में आपको छुट्टी वैसे ही मिल जाएगी, तो अगर आप ठीक हो रहे हो तो ठीक होके जाओ. एक बंदी ने कुछ कह दिया तो मैं उसके लिए सॉरी बोलती हूँ. वो आगे से ऐसा नहीं करेगी. आपके साथ भी नहीं, किसी और के स्टाफ भी नहीं. मैं किसी और हाउसकीपिंग स्टाफ को आपका टेक केयर करने के लिए अपॉइंट कर दूंगी.
आप मुझे डिस्चार्ज दे दो. मैं नहीं चाहती. मेरे फ्रेंड ने भी यही कहा है कि आप ये हॉस्पिटल में मत रुकिए जहाँ पे आपकी इतनी इंसल्ट हो. मेरी इतनी इंसल्ट.
मैम आई एम सेइंग सॉरी ऑन बिहाफ ऑफ माय स्टाफ.
नहीं मैडम, आपने सॉरी नहीं बोलना चाहिए. आप उनसे
Can I request everyone to come in? Actually, Aditi played her role the way actually she must be handling her situations.
He was adamant कि मेरे को छुट्टी चाहिए. वो सुनने को ही राजी नहीं है.
So.
But at the end, हमारे यहाँ पे वो पेशेंट मान जाते हैं कि हम ठीक हो रहे हैं, चलो हम आप किसी और को कर दो. लेकिन ये तो माने ही नहीं.
Okay, will somebody else take Aditi's position and do the discussion with the patient? Anybody else who is ready to take Aditi's position? Okay, Dr. Neha has agreed. So we all switch off our videos and Dr. Neha, 2 minutes time, Dr. Neha. Dr. Neha, you will also have to switch off your video, because when you will talk, your video and audio both will go out of place. So Dr. Kundan will have to speak to imaginary doctor. Yes, Dr. Neha, go ahead.
So, मैडम सुनीता, बताइए आपके साथ क्या प्रॉब्लम हुआ?
देखिए डॉक्टर, ये आपके जो हाउसकीपिंग स्टाफ है बहुत बदतमीजी से बात किया. मुझे बताया कि आप इतने बड़ी हो गए तो भी आप बेड में यूरिन कर रहे हैं. तो ऐसा थोड़ी होता है. मुझे अभी डिस्चार्ज दे दो. आई डोंट वांट टू स्टे इन दिस हॉस्पिटल जहाँ पे मेरा इतना इंसल्ट हुआ है. मेरे फ्रेंड के सामने मेरा इंसल्ट हुआ है. तो मैं नहीं चाहती. मैं आपके हॉस्पिटल में नहीं रुकना चाहती. और ये पता नहीं मेरे से ऐसा हुआ, फिर और किसी से भी यही बात करेगी तो मुझे आप डिस्चार्ज दे दो, आई एम ओके विद दैट। ये अभी नहीं, मैं बहुत हर्ट हो गई हूँ, मेरे पेरेंट्स भी मेरे से ऐसे बात नहीं करते।
हाँ मैडम, आई एग्री आपकी, मैं पूरी बात ये समझ रही हूँ। 2 मिनट आप शांति से मेरी बात सुने। ये बिल्कुल सही है जो आपके साथ हुआ, बिल्कुल गलत हुआ, ऐसा नहीं होना चाहिए था। एक चीज हम लोग की इनकी ट्रेनिंग्स वगैरह हम लोग हमेशा करते रहते हैं। ये नया नया स्टाफ आया है अभी, वी हैव डन लॉट ऑफ ट्रेनिंग्स ऑल्सो एंड आई एम श्योर हम लोग इसमें और आगे इनको ट्रेन करेंगे। आपके लिए एक पुराना स्टाफ देंगे। हमारे पास यहाँ कंटिजेंसी हो गई, फ्यू ऑफ द स्टाफ वर सिक, वो बीमार हो गए तो हमें इनको लाना पड़ा। अदरवाइज हम हमेशा पहले नए स्टाफ को उनके साथ एक सीनियर स्टाफ रखते हैं, उसके बाद 1 महीने की ट्रेनिंग देने के बाद लाते हैं। बट इट वाज अनफॉर्चुनेट।
आपने तो मुझे अच्छा ट्रीटमेंट दिया मैडम, बट आप आप क्यों मैनेजमेंट से बात करनी है मुझे? ये तो आपका डिपार्टमेंट नहीं है। ये जो हाउसकीपिंग जो उन्होंने गलत किया, आप उनको बुला के मेरे से सॉरी बुलवाइए और मेरे फ्रेंड के सामने मेरे सॉरी बुलवाइए। मेरा बहुत एम्बेरसमेंट हुआ है और मैं इसके साथ नहीं, आई डोंट वांट टू कंटिन्यू विद दिस इशू। तो आप नहीं तो डिस्चार्ज कीजिए या फिर वो जो हाउसकीपिंग की बंदी है उसको।
आप मैं उनकी तरफ से मैं सॉरी भी बोल रही हूँ और उन मेक श्योर करेंगे कि आगे बिल्कुल भी किसी के साथ, आपके साथ या किसी और के साथ ना हो। एक इमरजेंसी सिचुएशन की वजह से नए स्टाफ को हमें लेना पड़ा है, सो नेचुरली दैट्स बिकॉज समहाउ वी हैव टू ट्रीट द पेशेंट, बट इट इज अनफॉर्चुनेट कि ऐसे वर्ड्स उसने बोले हैं। उनकी समझ में और हमारी समझ में फर्क है।
प्लीज अनम्यूट योर डिवाइस। डॉक्टर कुंदन, प्लीज अनम्यूट योर डिवाइस।
आप क्यों सॉरी बोलेंगे डॉक्टर? आपने तो मुझे अच्छा ट्रीटमेंट दिया। मुझे वो बंदी चाहिए जिसने ऐसा किया, और आप सबके सामने मेरे से उसको आपने पनिश करना चाहिए या फिर सॉरी बोलना चाहिए।
मैडम अगर मेरी बात आप सुने, फिर हमारे और उसमें फर्क क्या रह जाएगा कि अगर हम उसको बुला के, जो एक नया स्टाफ है अभी लर्निंग स्टेज में था, हमें इमरजेंसी में लाना पड़ा उसको साथ में इंडिविजुअल हेल्प के लिए। अदरवाइज हम हमेशा साथ में रखते हैं नए नए स्टाफ को। सो अगर आप मुझे सिर्फ अलाउ करें, I am really sorry for whatever has happened, but we did not want to continue the service. Some emergency, because everybody is a human being. Some older staff emergency had occurred, so that's why she was not able to come. So we had to give some service. So that's why we are really very sorry for this.
Thank you.
If you just give, I mean, we really want that you should be okay and you should not feel bad about it. If you say, I can give in written about the apology.
Dr. Neha, although what you were trying to do was wonderful, you were trying to, कहीं आकर ऐसा नहीं हो गया कि हम बहुत desperate हो गए to stop the patient? अब ये कहेगी कि मुझे
ये थोड़ा था, we could have said कि okay fine, one more liner, if you still want that, you want to go, then we will not stop you.
Although you were trying to give wonderful reasons कि नया स्टाफ था, हम ट्रेनिंग देते हैं, इमरजेंसी, क्योंकि जैसे जैसे हम जो चेयर पे होते हैं ना, हमें उसके रीजन देने आ जाते हैं। तो you were really giving good reasons कि नया
yeah, but you are absolutely right, because one thing I could have said also, adding that of course even then if you feel that you would like to go, then we are not going to stop you, but we would definitely like that you stay and take full treatment, and we are able to discharge you with full treatment and you are okay and fine.
Okay, so a couple of questions that I want to ask here. One is, it's both about Aditi and Dr. Neha. And Aditi and Dr. Neha, it's not that we are anywhere finding fault with you or this thing. It's, you require a lot of courage to do the role play, and it's very difficult. I appreciate and I congratulate that you took that responsibility of doing role play. But we want to learn from this role play. So if I may ask the other members who were just observing, how about the speed of speaking? Tone of voice.
Ma'am.
It plays a very important
Dr.
role.
Manisha, your camera is almost like, above your head. Yeah, that's nice. That's wonderful. Yeah. You want to say something, Dr. Manisha?
Yes, ma'am. I just want to say something that when we are going to attend a patient who has complained to us, we should first listen to the complaint.
Okay, one sec. I'm coming to your point. So let me ask this question. So one, I said speed of speaking. interruption, tone of voice, because these are all paralanguage aspects. These are the things that play a role. Like Dr. Manisha is saying, listening. First, asking the patient, even if you know what has happened, but you want to hear it from the horse's mouth. Plus, you will get a chance to maybe get some information that you have not received from your patient. Maybe not your patient, from your staff. Your staff, when they say, इतनी बड़ी होकर उसने MRI टेबल के ऊपर पेशाब कर दिया, कितनी गंदगी होगी, वो तो साफ करना कितना मुश्किल है, MRI मशीन सारी हमारी खराब होगी. Now, if you have heard this version, I'm sure inside you also will be boiling that what nonsense it is. 26 years old girl, can't she manage her urine? Can't she tell that I need to use the toilet? And she has spoiled the machine, and now who will clean the machine? And I don't know where all that urine will go and what all damage will that do. But like Dr. Manisha said, listen to them, listen to their story. Maybe they have something to say that actually would completely change your mind, that what you were thinking and what pretext you have come with probably is completely wrong. So listening, one, that it would help to know the facts from the patient's point of view. Maybe patient's story is very different. If she says, I requested 4 or 5 times for urinal, I asked for bedpan, I was experiencing pressure, I was pressing that button that please allow me to use bedpan. Nobody heard me, nobody cooperated, and that's why I spoiled the bed. Now what anger will you have? So plus, like you said, listening means they get a feeling that, okay, somebody is ready to listen to my version of story also. So I think that was a very valid point made by Dr. Manisha. What do others say? What do others say? If I may ask you to add one point, each one of you, so that everybody gets a chance to speak. Dr. Amrit, Deepika, Pallavi, Payal, Sneha, Santoshi. What is your opinion?
We have to be a little more empathetic towards the patient also, because we have to look at it like this, that her age and especially the people around, it is actually very, very embarrassing and causes so much mental trauma to the patient.
Even if nobody says anything, when we fall on the road, unfortunately, we feel so ashamed that I fell. Although
yes,
it could be nobody's fault, but you feel so embarrassed that, oh, I fell, and somebody urinating on MRI machine or on a stretcher, it's not a very pleasant experience. So I'm sure you're right. A lot of empathy is required to understand patient's plight in that case. What else? What do others say? Payal, Sneha, Santoshi, Aditi, Deepika.
Can you hear me, ma'am?
Yes.
Yeah, ma'am, here we have to, as a healthcare professional, we have to maintain the dignity of a patient. And that is extreme. I'm really very sorry, my kid is here. So here, we have to ensure the patient, like we will be kind of having the grooming sessions and communication sessions for the housekeeping staff to ensure that that is not repeated in the form of a corrective action, that how they need to communicate, especially housekeeping staff, especially the corporate hospitals nowadays. So that we have to ensure.
I completely agree with you. So if I may add one point here, could we have shifted the patient's focus? Although Dr. Neha did try that, I'm not saying she didn't try, and even Aditi made a mention of it, to her recovery, her illness, and the need to be in the hospital. Although both of them were bringing that up. But we were kind of sounding desperate in both the cases. If I throw the ball in the patient's court and I say, see, I understand that this is a very unfortunate episode. This should not have happened. But I think at the same time, we have to remember that you are under treatment. Patient had pneumonia, Dr. Kundan?
Yes.
Okay.
Yes.
So you are still recovering from pneumonia, and your lung condition is still very fragile. and you are, getting medicines through IV. If you move from here and go to another hospital, of course, I'll give you your discharge date. But then we have already started treating you and you are on the path of recovery. And you have just now mentioned that you are okay with our treatment. So see, sometimes we have to look at the larger picture. So I understand that you are very upset and this is something very unfortunate that she has talked to you. They are supposed to be more sensitive, but we also have to understand their background. They are not very educated and they come from a very humble background. But right now, I think I would recommend that you please remember that you are under our treatment and you are satisfied with the treatment and your recovery. So one thing, yeah, Diti, you want to say something?
जैसे आपने बड़े प्यार से समझाया पेशेंट को, जैसे just give the example, but patient doesn't listen. मतलब he like अभी कुंदन सर बोले जा रहे थे मुझे छुट्टी चाहिए, छुट्टी चाहिए, छुट्टी चाहिए, छुट्टी चाहिए. Same way if we try to counsel a patient regarding any problem, they keep on saying छुट्टी चाहिए, ये हो गया, ये हो गया, ये हो गया, वो तो हमारी सुनता ही नहीं है कुछ.
Okay, so hold on.
He keep on saying his own stuff.
Okay, you want Dr. Kundan to play the same role, or Aditi, you want to play the role of patient?
I will play the role of a patient.
Okay, so everybody please switch off your video and let me, be the doctor or manager, whatever you want to call me. I'm playing Aditi's role, who's an administrator. And आप मेरे पास आए हैं या मैं आपके पास आई हूँ, ये मान लेते हैं कि मुझे पता लगा कि आपने कहा है कि मुझे छुट्टी कर दी थी और मैं आपके पास आई, एंड आई एम योर ट्रीटिंग डॉक्टर. ठीक है, तो मैं आई कॉल यू बाय नेम अदिति, क्योंकि मुझे अदिति बुलाने में आसानी होगी. ठीक है, तो हेलो अदिति, हाउ आर यू?
मैं ठीक हूँ मैम. वो बहुत बुरा हुआ मेरे साथ. वो स्वीपर स्टाफ कहता मुझे कि मैं वॉशरूम करती रहती हूँ अपने बेड के ऊपर. मुझे बिल्कुल अच्छा नहीं लगा. वो भी इतने सारे पेशेंट के सामने, जनरल वार्ड में हूँ मैं, इतने सारे पेशेंट लेटे हैं, सबके सामने उसने बोला. मुझे बहुत ह्यूमिलेटिंग लगा. मेरे फ्रेंड के सामने तो बोला ही बोला, और जो स्ट्रेंजर्स हैं जिनको मैं जानती भी नहीं, वो जो लेटे हैं उनके सामने ही बोला, उनके अटेंडेंट के सामने बोला. मुझे तो छुट्टी चाहिए, अब मैं नहीं रह सकती ऐसे अस्पताल में, और अब छुट्टी कर दो बस मेरी.
क्या हुआ, क्या था, क्या मुझे बताओगे?
मैम वो मैं वॉशरूम हो गया वो बेड पे, और बस उसने कमेंट पास कर दिया. अब मेरे को बहुत बुरा लगा, अपना बहुत ईगो हर्ट हुआ मेरा. और जितने लोग बैठे थे, अगर मैं अकेले में तो चलो सह भी लेता इंसान, लेकिन इतने सारे लोग थे. मेरा दोस्त तो चलो छोड़ था ही था, और स्ट्रेंजर्स भी थे, उनके अटेंडेंट भी थे, एंड दे ऑल कीप ऑन, मतलब मेरे को देखने लग गए कि ऐसा क्या कर दिया मैंने, बाहर तोड़ दिया मैंने, पता नहीं क्या कर दिया मैंने. तो ये बहुत गलत है, मुझे को छुट्टी चाहिए. आई वांट छुट्टी.
आपका ब्लैडर फुल था उस वक्त?
बहुत फुल था. मैंने वो बहुत फुल, अब ऐसे तो मैं बोलूंगी ही ना.
बोलो.
मेरा ब्लैडर बहुत फुल था. मैंने बोला भी उसको कि मेरे को वॉशरूम जाने, पर उसने कुछ मेरे को लाके भी नहीं दिया, और ना वो मुझे लेके गई अपने साथ. मैंने उसे कितनी बार बोला कि मेरे को,
उन्होंने आपको हेल्प नहीं करा?
नहीं करा हेल्प. तो वो वहां निकल गया. आप निकल गया, चलो ठीक है निकल गया, उसको कमेंट पास करने की क्या जरूरत थी? वो कमेंट पास करते सारे लोग थे, 10 जने थे, स्ट्रेंजर्स थे, मैं जिनको जानती भी नहीं थी, उनके साथ उन्होंने सामने ऐसा बोला. तो मुझे तो छुट्टी चाहिए मैम. अब मेरे को घर जाना है. अब मैं नहीं रह सकती ऐसे जगह पे. कल फिर वो आएगी, फिर वो मुझे देखेगी, फिर मेरे को बहुत बुरा लगेगा. ऐसे ऐसे कर रही करे देख के मुझे पुरानी बात याद आएगी.
अदिति, मैं समझती हूँ कि ये बहुत ही एम्बैरेसिंग सिचुएशन हुई आपके साथ.
हाँ मैम, बहुत एम्बैरेसिंग था. मैं नहीं रह सकती. अब मेरे को छुट्टी दे दो.
देखो, आप छुट्टी के लिए कहोगे, मैं वही कहूंगी कि कोई दिक्कत नहीं है. आप कहोगे मैं कागज बना दूंगी, आप छुट्टी लेके
कागज बना दो मैम, छुट्टी दे दो.
लेकिन अदिति, इस वक्त आपकी जो ट्रीटमेंट चल रही है उससे आपको पिछले 2 दिनों में काफी चेंज आया है. आपका फीवर
हाँ मैम, मुझे बहुत अच्छा ट्रीटमेंट मिला है. मुझे ट्रीटमेंट से कोई दिक्कत नहीं है. अब मैं जब भर्ती हुई थी, मुझे पता है मैं किस हालत में थी, और अब मैं बहुत अच्छी हूँ. लेकिन जो हुआ वो अच्छा नहीं हुआ.
देखो, मैं ये इस बात से इनकार नहीं कर रही कि जो स्टाफ ने करा वो बहुत गलत था, वो नहीं होना चाहिए था. पर कभी कभी ऐसा होता है कि लाइफ में ऐसे एक्सपीरियंसेस होते हैं जो हम कई बार एक्सपेक्ट नहीं करते, पर हमारे साथ हो जाते हैं. लेकिन एट द सेम टाइम हमें ये प्रायोरिटी पे ध्यान देना होता है कि इस सिचुएशन में ज्यादा इंपॉर्टेंट क्या है. अगर इस वक्त मैं देखूँ तो मुझे लगता है हमारा ध्यान इस बात पर होना चाहिए कि अगर आपकी रिकवरी हो रही है तो आप पूरी तरह रिकवर होकर यहाँ से जाओ. अगर आप मुझे कहोगे छुट्टी दे दो, मैं दे सकती हूँ, आपकी पर्ची बना दूंगी, आप कहीं और जाओगे, नई सिरे से वो दोबारा टेस्ट करेंगे, नई सिरे से दोबारा ट्रीटमेंट आपकी करेंगे. आपके लिए मैं ये एडवाइस नहीं करूंगी कि निमोनिया कोई छोटी प्रॉब्लम नहीं है. छोटा मोटा अगर कफ कोल्ड होता है ना, मैं कहती ठीक है आप घर जाके दवाई ले
हाँ
लीजिएगा.
मैम, लेकिन आप समझो ना, मेरे को कोई दिक्कत नहीं थी. मैं तो बिल्कुल ठीक हो रही थी. इतने दिन से भर्ती हूँ मैं. 2 दिन या 3 दिन भी रोक लेते, मैं रुक जाती. लेकिन जो उसने बोला मुझे बहुत बुरा लगा. इतने सारे स्ट्रेंजर्स थे, उनका अटेंडेंट थे, उसके सामने बोला. तो अब मैं वहां पे जाके फिर लेटूंगी उन्हीं लोगों के सामने, तो फिर मुझे बहुत ह्यूमिलेटिंग फील होगा। या फिर मेरा रूम बदल दो या फिर कुछ कर दो ताकि
मैं
मैं
आपको यही एग्जैक्टली यही कहने वाली थी अदिति, कि अगर मैं आपका बेड वहां से चेंज करवा दूं, डू यू थिंक दैट विल हेल्प यू?
हाँ शायद। और दैट अटेंडेंट आल्सो।
हाँ, मैं यही कहने वाली थी कि अगर मैं आपका रूम चेंज करवा देती हूँ तो फिर लोगों को आपको फेस नहीं करना, तो थोड़ा सा एटलीस्ट ये तो हो जाएगा कि यू आर नॉट फेसिंग देम। और मैं उस स्टाफ से भी बात करूंगी जिन्होंने आपके साथ मिसबिहेव करा, और मैं उनको आपके सामने नहीं आने के लिए कहूंगी, क्योंकि मैं समझती हूँ कि आपके मन में उनके प्रति गुस्सा है।
हाँ
तो
बहुत गुस्सा है।
वो
ऐसे कैसे वो
शायद
किसी को बोल सकती है कि ऐसा कर लिया मैंने कर लिया। हो जाता है, ह्यूमन बीइंग है, और वो गलती तो उन्हीं की थी, उन्होंने लाके नहीं दिया या मुझे लेके नहीं गई।
हम सबके साथ भी होता है, कभी कभी हम बहुत जैसे कहीं बाहर जाते हैं और कहीं बाहर हमें क्लीन यूरिनल नहीं मिलता, तो हम भागे भागे घर आते हैं, घर आते ही हमारे अपने कपड़े कई बार खराब हो जाते हैं, विच इज वेरी नेचुरल, दिस इज नथिंग एबनॉर्मल। सबसे पहले तो आप अपने मन में रखो कि आपसे कोई गलती नहीं हुई है ना, ये ध्यान रखो आपसे कोई गलती नहीं हुई है। और जो आपको प्रॉब्लम है उसका जो आप कह रहे हो कि आपको शर्म आ रही है, वो मैं समझती हूँ। तो मैं आपका बेड चेंज करवा देती हूँ, और स्टाफ को भी मैं कह देती हूँ कि भाई वो आपके सामने ना पड़े। 2 दिन की बात है, आप अपना ट्रीटमेंट कराओ, अपने घर जाओ, आराम से ठीक ठाक जाओ। हम भी चाहते हैं कि आप अच्छा हंसते खेलते हुए बाहर जाओ, ठीक है? कैन आई रिक्वेस्ट एवरीवन टू कम इन?
मैम ये तो बहुत सही हुआ, लेकिन पेशेंट सुनते नहीं है। मतलब लाइक इट हैपेंड रियली वेल। I finally
Ma'am,
got convinced
देखिए,
कि I will change my
आप
bed and I'll
aggressive
go to
होते,
next room and
देखो
I'll
ma'am,
sleep
मैंने
I
upstairs
also,
also.
I also
अदिति,
want to say this, ma'am. If the patient says मुझे जाना ही है, then what would you do?
ठीक है, in assertion you say what you want to say, you are helpful, you are kind, you are compassionate, you want to help the patient, you are empathizing, you are even saying that this has happened with me also। अगर मैं बाहर जाती हूँ और मैं अगर मुझे कोई क्लीन अगर यूरिनल नहीं मिलता, घर आके कई बार मेरे कपड़े खराब हो जाते हैं बिफोर आई कैन यूज माई यूरिनल, सो इट्स वेरी नेचुरल। तो इसमें आप एम्बेरस मत हो। अगर फिर भी वो मुझे कहती है मुझे जाना है, तो देखो मैं एक ही फिर बात कहूंगी, अगर आप जाना चाहते हो तो घर मत जाना, कहीं और जगह एडमिट
मैम मैं
Hospital, हाँ, another hospital.
एक दो ऐसा मतलब एक एग्जांपल देते कि ऐसे केस भी आते हैं हमारे हॉस्पिटल में, जैसे पेशेंट हैज एन ऑक्यूपेंसी ऑफ प्राइवेट रूम बट हॉस्पिटल डजंट हैव प्राइवेट रूम वेकेंट, तो हम उन्हें जनरल वार्ड में लिटाते हैं एंड वी एक्सप्लेन टू देम कि आपके पेशेंट की हालत खराब है, हो सकता है कल सुबह छुट्टी हो जाए किसी प्राइवेट रूम की, तो आपको शिफ्ट कर देंगे। बट दे आर वेरी एडमेंट कि हमें तो प्राइवेट रूम ही चाहिए, अदरवाइज हमारी फाइल कैंसिल करा दो, विल गो। बट वी ट्राई टू मेक देम कन्विंस देम कि पेशेंट
देखो,
की हालत खराब है, यू शुड
अगर
थिंक
हम
अबाउट द पेशेंट।
अदिति, अगर हम पेशेंट को इसलिए रोक रहे हैं कि हमें पेशेंट को रोकना है और मेरे पास बेड नहीं है, मैं उसको जनरल वार्ड में डाल दूं, तो आई कैन गिव देम द ऑप्शन। उसमें पे देखो, जहां पे डेस्पिरेशन दिखाओगे, जहां पर आप अपने आप को डिफेंसिव उसमें आ जाओगे, सामने वाला आप पे हावी होगा। आप मुझे ये बोलो कि मुझे मुझे बेड वो चाहिए, तो मैं आपको जवाब ये दूंगी कि देखो मेरे पास अभी प्राइवेट रूम नहीं है, आपकी इच्छा है, आप एडमिट होना चाहे हो सकते हैं। अगर आपको जनरल वार्ड में कंफर्टेबल नहीं है, यू आर फ्री टू गो, मैं आपको रोकूंगी नहीं। लेकिन मुझे उम्मीद है कि एक बेड हमारा कल सुबह खाली हो जाएगा। एक रात भर की बात है, अगर आपको लगता है कि यू आर कंफर्टेबल, आज मैं आपको कॉर्नर वाला बेड दे देती हूँ, वहाँ थोड़ी डिस्टर्बेंस कम होती है, एंड कल सुबह आपको बुक कर देंगे। लेकिन अगर आप बिल्कुल नहीं रुकना चाहते, आप जा सकते हैं, कोई दिक्कत
हाँ वी डू द सेम थिंग बट डेस्परेट इन द सेंस इसलिए होते हैं कि पेशेंट की हालत सही में खराब होती है एंड वी वांट टू
जाने दो ना
ट्रीटमेंट।
अदिति। अदिति, जब तक आप पकड़ने की पकड़न पकड़ाई खेली हुई है बचपन में, सबने सबने खेली हुई है पकड़न पकड़ाई। पकड़न पकड़ाई में क्या होता है, जब आगे वाला दौड़ता है, पीछे वाला उसके पीछे दौड़ता है, ठीक है? जब पीछे वाला दौड़ना बंद कर देता है, तो आगे वाला क्या करता है? दौड़ता है,
रुक जाता है।
वो भी रुक
जाता है।
जाता है.
जब तक आप पेशेंट के पीछे भागोगे कि पेशेंट आपसे आगे भागेगा। जब तक ये अप्रोच में चेंज नहीं लाओगे, पेशेंट को अगर ये लगता है कि ये मेरे पीछे भाग रहे हैं क्योंकि इनको मेरी एडमिशन की जरूरत है और मेरे पैसे की जरूरत है, तो वो आपके आगे भागेगा।
ये बहुत पेशेंट्स की थिंकिंग ये होती है कि इनको पैसे की जरूरत है, बट हो सकता है बहुत
उनको
लोग
आप एंडोर्स मत करो ना, आप फ्री विल दो उनको, सेट देम फ्री, लेट देम चूज, लेट देम चूज। दैट्स व्हाट आई एम ट्राइंग टू टेल यू, कि चेंज योर अप्रोच। यस डॉक्टर कुंदन, यू वांट टू से समथिंग, गो अहेड।
I wanted to say the outcome of this real story. What happened? So it was a Sunday. I think Dr. Indu ma'am very well explained to the patient. I think so what happened. I was not there in the hospital. I was at home. So she was not listening. So I sent one of my colleague intensivist who I knew would be understanding, listening to the patient. So she counseled the patient, and there was some change as what you demonstrated. There was some change after that, but still she was not completely convinced. So at that time, I didn't do this program of master's training. So I employed one of my old trick. I told them that I told them that I'll speak to her on the phone. So I was connected. Then I told them it's okay, whatever has happened, and the doctor has spoken to you about this. But then if still after this you want to get discharged, then only thing is there is a problem with the LAMA, and I think your insurance may get cancelled. So you'll have to pay out of your pocket. So then she stayed for 2 days in the hospital and she went. So I agree, this is not actually this way, but then somehow it worked for her.
But I mean, it's okay. I know we have sometimes, out of desperation, we try different ways.
Ma'am,
Question I have, one more question I have, small. There's a patient who came today in the morning. She was admitted 2 days, 1 day before. आज सुबह उसका फेविडोल का इंजेक्शन चल रहा था तो उसको बुखार नहीं आ रहा था, तो अटेंडेंट केम एंड पेशेंट अब ठीक है, उसको बुखार भी नहीं आ रहा है, हमें छुट्टी चाहिए. बट डॉक्टर आफ्टर द राउंड वाज ऑफ द ओपिनियन कि अभी छुट्टी की रिक्वायरमेंट नहीं है क्योंकि अभी तो इंजेक्शन चल रहे हैं बुखार के, तो अभी इसलिए बुखार नहीं आ रहा. बट ही वाज लाइक हमें तो छुट्टी चाहिए, हमारा पेशेंट ठीक है हमारे हिसाब से. तो एट द एंड मैं ये पूछ रहा कि हमें पेशेंट को रोकना चाहिए, वी विल ट्राई टू कन्विंस द पेशेंट टू स्टे, उसको दिक्कत है, या विल लेट हिम गो.
अदिति, पूरा एक्सप्लेन कर दो और उनको बोल दो मैं आपको एक समरी बना देती हूँ, आप किसी का सेकंड ओपिनियन ले लीजिए. यू कैन चेक विद समबडी. अगर अभी इतना आपका काउंट आया है, क्योंकि डेफिनेटली आपने उनका ब्लड काउंट करवाया होगा, फीवर का रिकॉर्ड बनाया होगा, जो जनरल कंडीशन है उसका रिकॉर्ड आपने बनाएगा. आप उनको बोलो कि ये सारा इसकी पेशेंट की इस वक्त एग्जिस्टिंग जनरल कंडीशन है और ये उसकी रिपोर्ट्स है. आप जाकर आप सेकंड ओपिनियन ले लीजिए, और अगर बाकी दूसरे डॉक्टर भी कहते हैं कि इनकी छुट्टी कर दो, आप करवाना चाहे करवा सकते हैं, पर इसको हम लामा में ट्रीट करेंगे बिकॉज अकॉर्डिंग टू अस वी कैन नॉट डिस्चार्ज यू.
हाँ, we gave him lama only at the end.
I think we have completely gone out of the program, out of this session. This session was about managing complaints, पर हम लोग चले गए पेशेंट के जा रहे लामा और उसको रोक. Come back, Dr. Priya, you want to say something? Keep it very brief. I know you hardly raise your hand, but then say what you have to say and then we move on to the presentation.
You mentioned about letting them go. I very much agree with you. I had a recent incidents on similar terms, and I had very sweetly told them that it's your call. You can go, but find out what they are offering you. And this is what we have for you. And strangely, within an hour's time, they were back and they proceeded with the procedure. So I agree with you with that one point.
Thank you. So I think if you looked at the conversation I had, I tried to be more understanding. Like Dr. Manisha said, listen to them. I tried to listen to the patient. I rather made her speak. I asked her to narrate the incident. Then I also empathized, saying that anybody in your place would feel, could experience something like this, and it's not your fault. Then I tried to even work on what will help her now. I even allowed her to talk about her emotions, and which I not only acknowledged but also validated. I validated those emotions. And then I asked, what do you want? And at the same time, I think both of us had the same thought. She said, change my room. And I said, I was thinking that if we give you another bed and move you from that area, probably you will feel more comfortable. And it worked out. So there is no one-line answer. Let me quickly go to the presentation. There's a lot more in the presentation. What we have discussed, you're going to get much more structured, presentation, but I don't know where the time will go. I think for the next 3-4 sessions, please pardon me if the session goes half an hour here and there, because there's a lot of content. All of you are very enthusiastic participants, very interactive. So naturally, I will not be able to keep a control on the time. Honestly, I don't care for the time. It should be a rich learning experience for each one of you. And therefore, please bear with me. If we go, Payal, you must be tired. I can see your heavy eyes, but I think it is worth the time. What do you say, Payal?
Yes, ma'am, yeah.
Aditi, you have raised your hand again.
No, ma'am, एक question
But the same case.
नहीं, एक question था. I just one more question. मेरे father का एक rule है कि he takes round of every patient as a management round. तो एक कोई ना कोई पेशेंट बोलता है कि हमें आराम नहीं आ रहा, तो वो कह देते हैं इनको रेफर करो, इनको आराम नहीं आ रहा, इनको रेफर करो. तो इज दिस द राइट अप्रोच?
This is threatening. This is threatening. If the patient requires referral, if the patient says, I want to go for second opinion, agree to it. But just to say, let go of the patient, see, that's an old school of thought. Parents use threat and aggressive reaction and authoritarian behavior with children. Medicine is no more paternalistic. It is adult to adult game. You need to treat your patient with same amount of respect, dignity, transparency, accountability. That's an old school of thought where I remember when I was a child, my mother used to take me to a doctor. In those days, I don't think we had pediatrician. I'm talking about 50 years ago. And that doctor was very rude, but his treatment would work for us. My mother will still go there, because he's a very good doctor. Take medicine, lete hi theek ho jate hain. I mean, we used to believe that he's very good. But now if you are that kind of doctor, your patients will run away from you.
Yeah.
That won't work. That won't work. So let me quickly share the screen and start with the presentation. We'll do in a hurried manner because most of it you have done, but we'll get everything in a very structured manner. So attend to the PPT so that you know how you have to actually do it. We have seen how to do it, but we have to understand the proper structure of doing it. Let me quickly show you the presentation. Okay, so these are different ways we all handle these situations. Sometimes we are passive responder. We say, okay, somebody will come, let somebody attend to you, doctor is not free, or the sister is not free, she'll come and listen to you, and we try to delay the addressing. Or sometimes we are very aggressive and we say, are you in a hospital or in a hotel? This is not a 5-star hotel that you're expecting, service at the bell of your distance. So that is an aggressive way of handling. The approach that we need to have is problem solving, because they are here for a reason. We want them to be with us and we want them to go happy, satisfied, because they are the one who are going to send you more patients. 75% of your footfall will come from the word of mouth that your satisfied patients will spend. So you have to remember, you have to have a problem solving approach. So I'm going to share a couple of steps that will help you to how to manage and resolve the complaint. The first thing is, please pay prompt attention. Show that you are happy to help them. If you have this expression, why are you here? You are a troublemaker. You are always coming with complaint. You are never satisfied. It is visible on your face. So make sure that you don't give that message to them. Make eye contact, greet the patient, attend to their physical comfort, ask them to sit down. Even if you're busy, if you tell them, just 2 minutes, let me finish this, I'll listen to you. It's always good to make them sit at a separate place, because if you give them a safe place, it's good for them and it is good for you also to talk in a comfortable manner. If you're doing this in an open area, for example, outside OPD, outside OT, outside labor room, there are others who are overhearing your conversation. This can complicate. It's always good to say, okay, let's sit and talk. I think you have some concern. I want to help you. Let's sit and talk. And then you kind of offer them a place where they can, share what they want to say. I think the first step when you start interacting with them is communicate the process that you're going to follow. So I think first thing is identify yourself, who you are. If you are manager, if you are coordinator, if you are doctor, if you are nurse, if you are front desk staff, if you are manager, whatever your designation is, say, I'm floor manager. I'm here to help you. And I'm here to, resolve your problem. So identify yourself so that they know whom they are talking to. Then explain the process and procedure. So you say, I want to listen to you. I'm here to understand what are your concerns. And I assure you that I'll try to, help you wherever I can. When they look upset, when they are very, annoyed, it's important to acknowledge their feelings. If they appear angry, you can say, I can see you're very upset. Don't say, I can see you're very furious. I can see you're very upset. I can see you're very disturbed. So when you say like this, they feel that, okay, there is somebody who's reading my emotions. And then you say, I think anybody in your place would be upset like this. I understand completely. Let me listen to what what is your concern so that I can help you. And then please remember, there will be some questions, there will be some demand. You should know that this is something that's going to come. So when my bag got broken, they knew that they have to either replace or they have to repair. So they knew that this is what I'm going to ask. And then when I said, I'm not wanting to complain online, I want you to register my complaint. They said, ma'am, this document says that we no more now write any complaint here. You have to go online and complain. I said, then how will you believe that this damage actually happened at the airport? She said, I have the pictures with me. I have taken the pictures of all 3 bags. I will be uploading from my side. You upload from yours. So she knew that these will be my questions and concerns. She was ready with the answers. So know what the client is going to ask you. I think step 3 is try to understand what are their concerns. A lot of time we go with what explanation we have on our mind. Ask and understand their concern. So when I asked Aditi, can you tell me what exactly happened? I think immediately Aditi realized, okay, now there is somebody who's asking me what had happened. And then when the person is speaking, we need to genuinely try to understand their concern. When she said this in front of strangers, she said this in front of bystanders, she said this in front of my boyfriend, and it was very embarrassing. I mean, anybody would understand that this is something not a very comfortable kind of a thing. When they're sharing their concern, we have to demonstrate that I'm listening to you. In that moment, if I demonstrate, I'm not listening to you, I'm not interested, this is all useless what you're talking, the patient is going to again feel all are same. They are not interested to help me. So these points we have already discussed earlier also. How do you demonstrate that you are listening attentively? Face the person, make adequate eye contact, stop doing everything, talk to the person, lean forward, nod. You saw I was making a lot of nodding gesture. Did you see that? When she was talking, I was just saying, yeah, I understand. Yeah, I think you're right. I was not making any verbal comment, but I was just facilitating her, venting out. And then avoid interrupting. So when Dr. Kundan and Aditi were interacting, you saw, Aditi, you were trying to justify, explain. If you interrupt, the other person feels I'm not allowed to speak. I'm being stopped. So that is where we have to be very careful. Allow them to vent. When you allow them to vent, a lot of their anger also get, vented. And then if you have any question to, then I asked her, did you ask for urinal? Yeah, I asked for urinal 2-3 times. She did not offer me. So I just kind of try to understand that did she make a request to get the urinal? Half the suffering diffuses if somebody actually genuinely tries to listen to the problem. So listening is actually therapeutic, and it's an action, because when you listen to their frustration, when you try to look at the situation from their point of view, and what is their concern? I was humiliated. I was embarrassed. I think these feelings were the ones that were disturbing her the most. So with that, you can also observe their demeanor, because you will get to know a lot from their facial expression. 93% is from the tone of voice and their facial and body expression. Mind also your own demeanor. Anywhere, if your expression shows, I'm not interested, I don't agree with you, you are lying, I don't care what you are feeling, you are just complaining, you are a complaint box. So if this is what you are showing, please remember you are not going to send your patient satisfied. So make sure your eye contact, your facial expression, your body language, your posture, your hand movement, everything communicates that you want to listen and you are seriously listening to them. When they are sharing their concern, stay calm, stay composed, don't interrupt them in between, don't try to correct them. Even if they're saying something wrong, you can note down and you can say, you said that there was nurse who did not listen to your problem. I've checked with the nurse. She said I wasn't there. If I was there, I would have definitely helped her. So if you want to correct misinformation, you don't have to interrupt there and say, what you're saying is wrong. No, you were wrong. This is not the truth. That will not help. So correct them, not then, but maybe later. And then don't be in hurry to justify yourself. That will show desperation, that will put you on a weaker pedestal. And then don't speak for the sake of speaking. Weigh your words. Think how you want to handle it. Because when you will speak slowly and when you will think and speak, your mind will give you more ideas how to go about resolving that problem. As I said earlier also, words play a very big role. Think of some of the, for example, Aditi, you said hyper mat hoiye. Your patient could actually lose control. आप कैसे कह रही है मैं हाइपर हो रहा हूँ? मैं हाइपर हो रहा हूँ? मैं हाइपर नहीं हो रहा हूँ. वो हाइपर होंगे पर उन्हें हाइपर वर्ड बड़ा इंसल्ट कर जाएंगे. So we have to be very careful of the words that we use with them. Then I will punish. गलती हो गई, मेरे स्टाफ से गलती हो गई. अगर मैंने ये कहा कि गलती होगी तो फिर वो मेरी और गलती करते हैं. So I have to say, I know this was an unfortunate incident. This was something not desirable. So you are not telling somebody has done wrong. You are saying this what happened is wrong. So there's a way to put things. So I think we have to learn that art of expressing. So when you say something like this, I don't care and I don't think I can do anything, or what can I do? That's not my fault. That's not my job. If as a doctor, as a nurse, as a friend, as staff, this is my way of interacting. Trust me, they know we are not going to help them in any way. A lot of time we are angry with them because they have complained. A lot of time they are angry because they have created fuss. We kind of give them tit for tat. किसी का discharge slip नहीं बना timely, उसका late हो गया, and that person has gone and complained against you, and then in the heart of your heart say, your discharge slip you will not get for next 2 hours. I'll make sure that you don't get discharged. So that's like tit for tat. Again, that's not a very desirable kind of a reaction to the situation. Empathize and acknowledge their feeling. 3 things that you probably saw me doing, that is acknowledge, normalize, generalize. I acknowledge that yes, anybody, if you have controlled your bladder and if you're not able to control, anybody can pee, sometimes at a very unexpected place. It is normal to feel like this. It is normal to pee. There is nothing to feel bad about it. I even gave my example that it happens with me also. If I go out and if I don't get a clean toilet anywhere, I would come home and sometimes I would spoil my clothes. So it is generalizing, normalizing. When you do like this, the person starts calming down. Okay, it's all right. It's nothing abnormal. Then try to see things from their perspective. 26 years old girl, if she has been, embarrassed by the housekeeping staff, इतनी बड़ी लड़की होकर तू अपना पेशाब नहीं कंट्रोल कर पाई. I mean, it's a very, and I'm sure housekeeping staff बहुत respectfully नहीं बोला होगा उसने. उसका बोलने का तरीका बहुत है. उसने ये नहीं कहा कि मैडम आपने बेड कैसे गीला कर दिया, आपको बेड नहीं गीला करना. उसने भी यही बोला होगा, इतनी बड़ी लड़की होगी तो अपना पेशाब नहीं कंट्रोल कर पाई. That could be very embarrassing for the patient. So we have to see things from their perspective. An apology, I think we have discussed. Apologize not for the mistake. Apologize for what they have gone through. I think that's a painful experience. Patient who is patient is already suffering. If they are waiting, they are in pain. If they have not been updated, they are concerned. If they are not told the condition of the patient and they are upset, it's natural because they are apprehensive. So apology has 2 expressions. Expression of compassion, which plays a bigger role. So when I say, I'm sorry that this unfortunate incident happened. I'm really sorry that you had to wait for so long. I'm really sorry your reports are not, traceable. I know it's not the way we should be functioning. I'm really sorry that you had to go through all this. So when you're saying sorry like this, you're not taking the responsibility, but you are apologizing for the inconvenience that you have caused to the patient. And of course, if somebody has misbehaved, there is no harm in saying, I'm sorry for my staff behavior. That was not uncalled for. I think we really need to upskill our staff. I take the responsibility. I think I definitely work on it. Thank you for bringing that to my knowledge. So that's more like expression of responsibility. When you say something like this, what you're saying, if it is true, then I think it's worth listening. Or there was a mistake, but that was not a deliberate. Or when you say, I'm sorry, but I can't attend to your individual because, so actually that apology is going to fail. That is not making any sense because you are giving a conditional apology. Conditional apology does not work. That's not the way we should be apologizing. So if something like this happened, then I think I must apologize. Again, it's a conditional apology. So once you have honestly communicated the apology for the inconvenience or for whatever has happened, I think now is the time to reassure of the context. There, you actually try to help them see that I want to help you. Make all efforts to reduce the suffering. Immediately come up with what you can think of. And at the same time, it's very important to check what does the patient want. For example, in Aditi's case, she said, can you change my room? So that was a very good solution coming from the patient. And if it is not difficult for me, I can do it. So check what the patient wants and sincerely try to resolve the issue and address the concern, and then focus on the solution rather than the patient's behavior. You may say, आप इतना चिल्ला के क्यों बात कर रहे हो? मैं आपको कमरा दे रही हूँ ना, मैं आपको दूसरा बेड दे रही हूँ, इतना चिल्ला के क्यों बात कर रहे हो? But that's not what we have to, how we have to react. And then avoid being defensive. I think I have emphasized on this number of times. The moment you will sound desperate, the moment you will appear defensive, trust me, the other party will overpower. Then you will be on a defense. So that is something that we don't desire. So when you are exploring alternatives, do it with an open mind, because then you may have to go even out of the regular ways of handling the situation. So when it comes to exploring alternatives, I would ask you to draw these 9 dots in your notebook. I hope all of you have a notebook with you. So draw these 9 dots in your notebook. Drawn?
Yes.
Anybody has done this activity earlier?
Ma'am, I've done with 3 dots.
3 dots? Okay. So maybe then this is different. So connect these all 9 dots with 4 straight lines without lifting your pen. I repeat, connect all 9 dots with 4 straight lines without lifting your pen. By the way, am I going too fast with the presentation? Somebody please respond.
No, madam.
Are you okay with this speed?
Yeah,
Because we have discussed most of the things, so therefore I'm not spending much time on the presentation. So these are 5 lines, Dr. Amrit. Check how many lines.
Actually, I wasn't paying attention to the number of dots. When it happened, I was just talking to somebody. Sorry. Inattentive student.
No problem. So all 9 dots with 4 straight lines.
I also could do a 5 only.
There's a study by Harvard that says
Me too, only 5.
every problem has minimum 4 solutions. And every solution
डॉट तो
should
रह ही जाता है.
रह जाता है ना? So you need to go out of the box and think, how can we connect these all 9 dots with 4 lines? So अगर सब कह देंगे कि I give up, then I will show you the solution. Give up?
yes, ma'am.
Everybody?
Yes.
Yes.
Yes, sir.
So here it is okay if you're saying give up, but in life, don't give up. Try. You should try.
Madam,
Yes.
Probably nobody would be counting the lines there. Hopefully.
So, see, these are all new situations and new problems
This-
in life. So you will have to really go out of the box in finding the solutions. There will not be any ready-made answers to the problems. The idea is that you have to go out of the box to see how you can find a solution.
oh,
Aditi हुआ?
very nice.
1, 2.
So the idea is go out of the box to find new solutions to the problems. There's another
Very
way.
interesting.
There's another way. Do you want to learn that?
Yes, ma'am.
And if I tell you that all these 9 dots can be connected with 3 straight lines, will you believe me? Will you believe me? So the idea is, what I'm trying to communicate to all of you is, please explore alternatives with an open mind. What your team cannot think, start thinking, creatively. Keep the larger interest in mind. Be mindful of the consequences. Sometimes we, become very stingy, or we become very miser, or we become very, picky on things, and then we lose a lot in that bargain. So you have to pick your battles. You have to be careful, because one step lost here can be a simple example I'll share with you. Somebody came from, this department, malaria control department, to my home and clinic. I wasn't at home. My husband was there and he was busy with his work, with his patient. So this lady said, I have to go to your top, rooftop to see if your water tanks are, well covered. I normally cover them very properly with proper lid and then a heavy brick kept over them. But my husband was occupied and I was not at home. Then he said, there's nobody at home and it's not possible. But that he said in a very, not in a very polite way. So this lady got annoyed because she wanted to see. We could have said the same thing politely, that I'm occupied right now, and plus, we why will we keep our water tank not full? But he was rude. He was little rude and very, This lady went and sent a challan to us that the water tanks were not covered. Now I don't have any way to prove that what she has complained is not right. All the way I had to go from here to the court, wherever they had asked us to come, to go and deposit that, 500 or 1,000 rupees penalty. The day I lost in that process, you can well imagine. So we have to be mindful of the consequences when we are, resolving issues. Negotiate confidently, clearly communicate what is doable and what is not doable. If the patient says waive off my thing, see, I cannot waive off your charges. That is not in my authority, but I can assure you that they will provide you the care as per these, standard protocols. So you are saying that you are taking the responsibility to give you the right treatment, but you cannot, waive off the charges. So in case if it is not in your authority and you think the something that the patient is asking is doable, but it's not in the authority, you can say, see, I can't take a decision on it, but I can definitely put this to my higher ups. And if they are ready to do it, I'll be more than happy to get this done for you. So give me a chance, let me speak to my seniors. And if they're okay with this, I'll be happy to do it. So you are communicating and assuring that you want to do it, but you have no authority to do it. So, and then you can appropriately, escalate to the higher up and genuinely try to forward, not with the comment, बिल्कुल मत करना, ये बेकार है, ये patient useless है. So you are kind of poisoning that person's life. So that will not be a very helpful way of doing it. So while you are exploring your, alternatives with the patient, please remember that you have to use assertion. Don't get into argument. Don't get into. I'm sorry. Have I missed something? Okay. So while exploring, make sure that you don't argue with them, because when it becomes argument, then it can go to any level. Instead, use assertion. That's the way to handle the situation. Then throughout the negotiation, please remember you have to be mindful of how you are feeling. Because inside, if you are angry, if you are boiling up, there's a possibility that you can also become aggressive. So be mindful of your feelings, of your, of what you are thinking, what your hot buttons are. Sometimes, this word hyper mat hoiye. The other person may say, आप इतने aggressively बोल रही हैं, आप बदतमीजी कर रही हैं. That बदतमीजी word can become a hot button for me and I can lose my control. So we have to be, knowing what my hot buttons are. And if you think you're not able to handle it, please pass it on to somebody, let somebody else handle it, rather than you, spoiling the situation and getting into trouble. After you have, resolved the issue, it's very important to, document whatever has happened. Especially make sure that you wrote down the person with whom that happened, name, contact, background situation, whatever the person had come with, whatever the problem was. how you responded, what are you offered, what you agreed, and ultimately, the solution that you worked on. So any suggestion that you want to give for future such incidents, that we should prevent this from happening. So really, kappa is a very useful tool, to be in such situations. And then your name and your signature, so that they know who has written the report, and in case if they want to reach you, how they can reach you. You can write your phone number, name, because you are the one who has attended it. Once everything is over, don't forget to sit and reflect. It's always a very good way to see how you can, change the way you handle it, how you can, make things better in the time to come. So reflection would help you improve your working. Sit back to check in, discuss with your team, read some relevant material. You'll get to know a lot of good ideas, and then work on upskilling your team and yourself, so that in case if you think your team does not know how to handle, I'm sure you can help them learn the right way of handling it. So these are the 10 steps that we have discussed just now. Again, you attend promptly, you communicate and the process, ask and understand their concern, acknowledge, express empathy, reassure prompt action, apologize, explore alternatives, document, and then reflect. Essential skills that you require to handle any complaint or any difficult situation, I think we can put them into 4 categories. Actually, you can note them down, these 4 things. One is we require effective communication techniques, which again covers verbal and non-verbal, attentive listening, and asking questions in a manner that you get most information. Second skill that we require is empathy and emotional intelligence. If you are able to look at things from the patient's point of view, you will actually be able to demonstrate a lot of empathy, and you will be able to calm the other person down, because usually our personal biases interfere with empathy, and we think that patients are complaining, patients are troubleshooter, which is actually not true. The third skill that we require is learning how to deal with the difficult situations, difficult complaints. So if you know how to handle aggressive patient party, if you know how to manage unreasonable demands, and if you know how to maintain professionalism and composure, you will be able to deal with any difficult situation. And fourth, which is equally important, and that is conflict resolution. So being able to identify the common sources of conflict, coming out with creative, solutions, being assertive and having a problem-solving approach, and negotiating and compromising technique. These will help you to handle any difficult situation. So if we may summarize the complaint management process, I think one is receiving complaint, very important, the way you receive it. Second is assessing the complaint. So you gather information from the person firsthand, and then from your staff, so that you know how serious is the problem, what is the truth actually, and what is the underlying issue. And then, of course, you develop a resolution strategy where you see how can we resolve the issue by minimizing the damage to the patient and to yourself. So definitely you'll be able to find some way that you can resolve the issue. So once you resolve the issue, resolve the complaint, communicate with the complainant, manage emotions, diffuse the tension, collaborate with stakeholders for resolution, and then once you have done it, follow up and monitor. Because maybe you say, okay, let's do it this way, but you need to follow up. Was it done on time? Was it done in a proper manner? To ensure it is done in a timely manner, in an appropriate manner. So that will kind of, help you close the situation. At the organizational level, I think it's important that we have some policies and procedure in place very clearly. Who is going to attend? Who is responsible for what? Not that anybody and every Tom, Dick, and Harry, starts handling it. So very clear and comprehensive policies define the role and responsibilities, and then please ensure consistency and fairness. In some case you agree, in other case you don't agree. Your staff will get confused what is right and wrong. So have consistent and fair approach, so that your staff knows, okay, if this has happened, this is what we are going to do. And then make sure that your solutions are, you comply with the legal and regulatory requirement, because ultimately we can be in trouble if we are not doing that. At the same time, I think staff training and support is very important, where the staff learns how to actually manage the complaint, because they are the frontliners and they are the one who have to handle the situation. So they must actually know what is the right way of handling customer complaints, how do they communicate. And then you could also work on their communication skills, emotional skills, and then you really need to provide them support and guidance when they actually start working with the patients. Of course, anything that you will start will require continuous improvement and feedback mechanism. So make sure not that once you have implemented, okay, that's okay. We really need to, monitor and see, are we doing it the right way? Do we need to make some more changes? Do we need to bring in something more? So take feedback from the complaint. Are you happy with the way we have handled it? Then you could do performance monitoring by physically being there or by having the CCTV recording, observing the recording, and then giving the feedback to the employee that this is where you need to, change your way. Like even the mock exercise that we are doing here, that's also a good way to review our performance and update. And then also encourage employee input, because a lot of time they will give you an idea of what is the problem source, and then they will help you to find the solution to the problem. Sorry, I had to really rush through the presentation, but then I wanted you to have a proper understanding of the structure. Any questions about the presentation? Did I really rush through? You're okay with that?
Somewhere, ma'am.
So you will have video recording. You can have a look at the recording once again. I know, but if I had not rushed through, then probably it will be 11 o'clock by the time we finish.
Yes, ma'am. But it was very informative.
Very.
So there is a way to handle this situation. It's very important that we know, we learn, our staff learns, and they are trained. You do their capacity building so that they learn how to actually handle the situation. Most of the problems can be looked after if your staff knows what are the steps to mitigate the situation. Because they are confused, they are not trained. So somebody might do it in a very good manner, somebody might do it in a different manner and can spoil the situation. So if there are no more questions, I will share the feedback form. So your feedback has to be on the topic that we have discussed and not on the presentation that our presenters are going to make now. So I think two members are going to present. I think Payal and Santoshi, am I right?
I'm also, madam.
Okay. Okay.
Three.
So maybe one of you can do next time if you are okay. Or do you want to have all three? Because we are left with the 3 more sessions. Yeah. Then how many more people are there left to present? 1, 2, 3, 4, and then 5. Yeah, that means. So let's finish. I think 3 of you can finish your presentation. Whoever is comfortable, let's finish this read. Why leave it to the next day? So who is wanting to present? I will give you the screen sharing rights. Okay. Yeah. Payal, you want to start first? Anybody? Payal, okay. Let Payal do it, because she has her family helping her to do the presentation. Go ahead, Payal. Perfectly all right. Go ahead. Yeah. We are all there with you. See, kids are smarter than us. They know how to handle. I also take a lot of help from that one. I know. I take a lot of help from my daughters,
Yeah.
They are smarter.
Okay. Thank you. Yeah. So, very good evening to everyone. Today we are going to start is with using the quizzes to engage your audience as your pedagogy. Yeah. So here I'm going to ask you a one simple quiz. Okay, we are going to ask you some question on your posture related, and you just have to see how much you know about the posture and how many answers you can get it corrected. So should we start? Yeah.
Sure.
Yeah.
Go ahead, please.
Yeah. So the first question is, the poor posture affects which body system? Is that your respiratory, digestive, circulatory, nervous, or all of the above? So the answer is all of the above. Yeah. So the second question, what is subluxation? A pinched nerve along the spine, a misaligned vertebral bone in the spine, act of correcting the spine back into the proper posture, or the term known as slouching? So the correct answer is the act of correcting the spine back into the proper posture, or the misaligned vertebral bone, the subluxation is a misaligned vertebral bone in your,
Vertebral bone
yeah,
is misaligned vertebral bone.
yes. The person has no control over their posture. How far it is true? Is it true? Is it false? Or is it somewhat true or the somewhat false? It is?
Somewhat true.
Yes,
Somewhat true.
true. Yes. So what are the three different parts of the spine? The upper, middle, lower, cervical, thoracic, and the lumbar, the ventral, dorsal, lateral, or the none of the above? The answer is
Cervical, thoracic.
lumbar. Yes. So how many people experience the back pain at the some point in their life? 5 on 10, everyone, 8 on 10, no one, or 9 on 10?
Everybody.
Everybody.
Yeah, it's like 8 on 10.
Okay.
The fingers in the king positions are best described as what? It is straight? Is it curved? Is it upright? Or it is a semi-rigid? It's a king position.
Curve.
Yes. So what are the most common posture problems? Slouching, inactivity, poor sleeping postures, or all of the above?
All of the above.
All of the above. Yes. So which one cannot improve your posture while standing? The stand up straight and tall, pull your stomach in, push your stomach out, or keep your head level?
C.
Yes, is the push your stomach out. So if you don't have an ergonomic chair, you could sit on a rounded shoulders, a head forward, the shoulder shrug, or all of the above.
All of the above.
All of the above.
So which should be the most correct position in your head, shoulder, and the arms when you sit in front of your computer? Oh, it's all good. I don't normally get hurt. Head forward, shoulders forward, arms reaching forward, or the head forward, shoulders back, arm reaching forward, or your head and neck nice and straight but then relaxed, the shoulders slightly back and the elbows at your 90-degree.
Yeah, last one.
Yes, yes, the head and neck is nice and straight and elbows at your 90-degree. Okay, so we have gone through with this simple quiz. Okay, so you understand that how much knowledge or how much understanding we know about our posture and our sitting habits. So why we have to use the quizzing as a pedagogy, or what is the main effective use of it? So if you can see, right, the quizzing tools can be used to provide the people with a comprehensive, accessible, and the evolving learning experience. It is an evolving learning experience. So it is not just a test you have to give, but you also learn from it. And there are many another questions or many different things you can comprehend with this. And it has a higher degree of customization and it is very much tailor-made. So whatever topics you want to take, you can customize accordingly. And what are the target populations are there? You can make the questionnaires along to your or whatever the need of your populations. So this is the most effective way of quizzing as you can use as your pedagogy. And how you make it so efficiently. The first is designing an insightful question. So if I give you my example, when I have designed this quiz, initially I have made a very simple questions. And when I have sent across to Indu ma'am, she said, no, just try and make it some interesting, right? So you have to design your questions in a little insightful way, that how you can engage your audience or how you can make your audience think about it. It should not be so easy or it should not be so hard also. It should be cannot be the out of the course too. and analyze your data. So whatever the data you get through it, you try and analyze it and try to work upon it, the where you can give some tricky questions, or where you want your audience, or where you want the topics has to be covered in the proper manner. And again, the redesigning and get the pair feedback also. So sometimes you have, if you do the questionnaires as a part of taking the feedback or giving the feedback, sometimes you need to redesign also according to the need of the era. So if I'll go like this, there are a lot many advantages of the questionnaires. The first is it's very inexpensive, right? You don't require a complete, some people to take sit and make an interview and use of a very different tools to make it, or it's a very time consuming. No, it is very inexpensive and you can do it, and you can target the large audience through it. It is very practical. So whenever you want to take any topic, you make the questionnaires, see your how is your targeted populations, and make it according to their need through it. It's very practical. You can not even cover the some people, but you can also cover the whole larger amount of populations through it. It gives you a very fast results. We can see this within a few seconds, or within a 1 or 2 minutes, you can see the results of what are the mindset of your populations are there, and where you think so you can take more of their detailed topics about it. It is used as a scalability, because you can see the 8 on 10 my answers are wrong, or 8 on 10 is my answers are right. You understand that how you can make more proper for it. It is used for the comparability, okay, the before and after. This way also you can help it out, and you understand that whether your intentions been like given properly or not. Easy to analyze, yes. Validity and the reliability, definitely it has a good validity and the reliability, and it is very standardized form. You can use it, and there is no pressure for the audience. Okay, they can take their own time and they can use it and they can give it. And there is no pressure, because the some you really cannot need to know that who has the answer has given. So yes, the respondents anonymity can be also be provided. So if you whatever the thing you think it is right, you can give your answer into that way. So everything comes with the advantages and the disadvantages. So it has a many disadvantages too. The first is the dishonest answer. Yeah, the people will give you proper right, yes or no, whatever they don't feel. So even though they say yes or no according to their manner, people can skip your questions also. They don't want to answer it. Interpretation issue, like sometimes if you use few words like cannot be, or sometimes you lead the questions the open lead, then also the interpretation issues can become. The lack of nuances, like there is a very fine line between the 8 on 10 or the 9 on 10, right? It's a very fine line to point out the differentiation. So yes, it can be a lack of nuances. The analysis issue can also happen. Hidden agendas. So if I'll make my questionnaires in certain way, that answer can come into this that directions only. So maybe the who wants to take the questionnaires, or the people who want to answer, there has to they can driven their answers in that manner. The lack of personalizations, yes. We cannot make the questionnaires according to the in each and every individual, so there is a lack of your personalizations. Inconsistent response, yes. And the accessibility issues, like it is not always necessary that everyone using the internet, the language barrier can be there, the interpretation issues can be there, so accessibility issues can be there. And the survey fatigue, if so many questionnaires can be given, the people will get fatigued to even answer every single time, and so many questions can be given and the feedback can be taken. Even sometimes the fatigue can be happen on the receiver side too. So if we see what are the do's and the don'ts of your this pedagogy, it's very easy, like let your learner to know upfront that how many questions we are going to ask you, or what is the topic we are going to cover to it, right? And you have to limit your distractions, that don't give them so many incorrect choices, or don't give them so many correct choices also. Okay, one or two out of this questions are right or wrong. Then design the performance-based quizzes that test applications of a skills and not simply your functional recall. So definitely give something so they can learn also through it. And create the quiz that engage your learners. So customize your quiz according to your targeted populations. And write and rewrite if you think so you need to be done for your questionnaires, and quiz that teach. Okay, it cannot just a test of your learners, but it also has to be some teaching into it, so they would be more and more engaged to it. And don'ts are like, yes, don't ask the questions about the content that was not covered. So do not ask out of the topics. There should be not too much overuse of false and then true, or the multiple choices and the open-ended questions also. Don't ask any negative questions like which of this you should not do or which of this you should. So not so many negative. Include confusing or the implausible distractions. Okay, incorporate the trick questions. Do not incorporate a lot many tricky questions, then the populations or their audience is going to lose the interest through it. And you need to shuffle the numbers of your answers. Okay, it should not be happen every time the 3 or the C has to be the right numerical number one. So shuffle the numbered answer that has to be needed. So these are the main things that we have to use, or we have to keep in our mind, the do's and don'ts, and it has a lot many advantages and a lot of disadvantages too. But if we use the quizzing in the right proper manner, and if you give some time and the questionnaire is in a little interesting way, definitely you will have a good answers, and you can engage your population in the right manner. So that was a quick presentation from my side. Thank you.
Thank you, Payal. I think it was very elaborate. You shared a lot of insight into. Usually, we think quiz is like to just energize and to activate your audience, but I think you have gone in depth to explain. If you're using it as a teaching tool, what are the things that you need to keep in mind? I think it was a very well designed, well researched pedagogy that you have presented. I congratulate you for that. Good work. Thank you. Any questions to Payal from anybody? Okay. So Payal, please don't forget to send your presentation in the group so that everybody can read it, because in 5 minutes you can't capture everything.
Sure. Yes.
Definitely, they'll once they start designing their training programs, I think these presentations will help them to design more efficiently. Thank you. So I think we have Santoshi and Dr. Kundan. So Santoshi, would you like to present next?
Yes, ma'am. I'll go with it.
Only request to both of you is please restrict to 8 minutes time. That's the only request.
Sure, ma'am. Sure. I'll try my level best. Yeah, I'll try my level best. Yeah.
Sure. Go ahead.
So good evening, team. Good evening, all of you. And trust all of you are doing good. And at this hour also, we all are here. And today is my day of presentation, and I'm just presenting my topic. Just a second, I'll put that in a presenter view. Hope you all can see my screen.
Not yet.
Okay, just a second, ma'am. Share screen.
Yeah.
Just a second. Yeah, now you all can see my screen.
Yes.
Yes.
So my topic for presentation is interesting activities on building trust. And as we all know that we all work in teams nowadays, and trust is very, very important component if we want to work in a team. So before discussing on that, how we can build up the trust, let me put this on one question. When we think about the people that we trust, who are they? Just kind of analyze that in your brain and in your mind, that whom all do you trust both in your personal and professional life? And the next question is that how do you know that you trust them? So more often when the question is asked like whom you trust, you always think the people who will first come to our mind will be our own personal relations, and then a way out will think of those with whom we are dealing on a day-to-day basis in a professional life. And hope you all have made up that who is on first, second, third, and fourth or fifth number, right? So, but here we will more talk about the professional relationship, that how we can build that trust amongst ourselves. So, and there have been many situations or couple of situations where we will come across a scenario where the person whom we have trusted a lot at a workplace has acted otherwise in a scenario where we wanted him to support us, right? So this is one of the things. So has it happened to anyone? If you can say yes.
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 Yeah.
Yes.
Yeah,
Yes.
so what was that hindrance? Did you trusted a wrong individual, or what happened, or you were not? So what was that hindrance that caused that? Because the trust is a thing that it cannot be built up in a minute, in a day, or in a month, or a year. It takes time, right? So how we can build that, where we lacked in building that trust, so that is more important, and that is where my whole topic will be, that how we can build this trust. So and most of the time what is happening here, like the individuals like us, usually we are working more than 30 to 50 hours in a week. And when we say this, as per the survey which was done by the Global Force, most of the times we are spending with the co-workers, and we hardly know them in a personal way. See, the people whom we trusted a lot, even in our workplace, you will always be like, you know that you have developed some kind of personal relationship with them, right? Yes. And the people whom we do not trust, we why we say we do not trust, because we did not try to know about them in a personal way.
If it is okay, can I interrupt you?
Yeah, ma'am.
I think we are slightly digressing from the topic.
No, ma'am, I'm going to cover that. Yeah. So it is very important to build the trust here. So as my topic is on trust building activity, so here why we need to have trust building activities amongst our team. So here we can improve our relationship, as well as we can improve our teamwork. So in the morning, I shared with all of you one exercise, right? Where I have asked a few questions, and where we were answering them. A few of us, you have answered them all, and few of us try to answer many of the questions. And thank you so much for the same. But how do you felt that when you are answering those questions? So that exercise, those questions that uh, were asked. So those questions were part of the team building process, and one of the activity which we use a lot nowadays, either before starting the session or during sessions or in between the session, just to build on more motivation and more teamwork. Those questions are known as icebreaker questions. And see, when you were answering those questions, what was the feeling? So here, when participant, or when the co-worker, or when we are kind of a facilitator, or when an attender or an audience is answering that question, the more of emotion is there behind each and every questions when they are answering. So it gives people opportunity to share something which they are proud of. Like many of us, like the first question, that to which animal or to creature we will relate ourselves. Many of us have written the names of birds. Few of us have given the names of animals like tiger. So now, by knowing, and hope you have gone through the answers of other like our teammates also, where you can understand now the personality. Like Dr. Kundan has written that he will see himself as a tiger, and Mamta has written dove, and even Amrit ma'am has written, uh, I'll say, eagle, right? So we can assume like how will be the personality. So before being a part of that team where the training is happening, we will more know our audience here. So this is one of the activity which is very frequently used, and it is easy to use, and we can do it just to build in trust amongst our team, because here we will know more about the person personally, and that will also build in confidence while working with them and while communicating with them. So here you can see, just a second. Like there are other activities also which we can frequently use during our team building sessions, like trust fall or a willow in a wind fall, where the person is allowed to go and it's blindfolded. Maybe he can close his eyes, or maybe he's blindfolded, and he is asked to fall on a group of an individual who can catch. But there is one more game which is known as willow in a wind, where he is, like you can see in this picture, where a person is blindfolded but is not asked to fall. He's just standing there and he's asked to just lean behind and try to show like he's falling, and the other teammates, they have to prevent him to fall. There is one more activity which we can try, is two truth and one lie, where each one of us, like we are 10 members here, so we can also, while starting or to build the trust or to initiate this activity, we can go for kind of mentioning two truth and one lie about us, and that can be kept in a kind of a piece of a and those all like two truth and one lie can be collected, and then one by one each one of us can be asked that the two truth which Santoshi is saying, what is like three things from my end has gone, out of which two are correct, two are truths, and two are lie about me. So here how that lie, whether it is lie, whether I'm lying or not, can be captured. So you have to just kind of assume that what is lie and what is truth. That also will help us in knowing more about the person. And the other is perfect square. And in this activity, if you can see, the individuals are asked to blindfold and to hold a rope in their hand, and to sit down, and they have to make a square blindfolded. They have to try to make it. And then and this activity will take hardly 5 to 10 minutes, where and once they feel that they have made a perfect square, they are asked to drop the rope down on the ground, and they are asked to unfold themselves, and then they have to see whether the perfect square was there or not. So this also kind of plays a very important role in building trust and in building team relationship. As well as there is one very famous blind snake activity which usually hospitals or companies or institutions get that done during team building workshop, like a blind snake, where all the members are asked to stand in a queue blindfolded, and the person who is standing last is like he is not blindfolded, and he guides the person who is first in that row, and then he has to take the whole team, the whole team has to follow as per the instructions given by the person who is not blindfolded at the end. So this also increases the trust amongst ourselves. As well as partner obstacle courses there, where we all have played this. Here obstacles will be placed, one person will be blindfolded and the other person will guide how to clear those obstacles, how to cross those obstacles. So other activities, human knot, where we have to tie human knot, and we have to ensure that we do not leave hands. This activity usually we can practice in small group, and this will also take less than 5 to minimum 10 minutes of time to finish. So all these activities we can use, we can follow to increase trust, because trust is very, very important nowadays. And the setup where we are working, it matters a lot, especially amongst our healthcare providers, where we are sharing information, we are documenting information, and we are then processing that information, and for further checks and reviews and for research purpose also. So trust is a very huge component, and all these activities can help us in building trust within our team. So what all are the advantages? And as we all are clear, it helps us in developing relationship, improving teamwork, and as well as we get to know about the capabilities and interest of a patient that helps us in completing the task more effectively. I know that Dr. Indu is very good in communication. So maybe when we are dividing that role, that who will do what, maybe I'm good at documentation, I'll take the role of documentation, and Dr. Indu can take the role of communication. Now, how I get to know about that? By having more communication, by having more activities with her, I got to know that. So that is how this activities helps us. What are the disadvantages? The disadvantages as such is like very few, but yes, that it makes a huge impact during training session. It's the time constraint. We cannot just go away with the activity. We should have a time limit where we need to stop and where we have to, again, we can restart. And but many times it happens that we have a group of 10 or 15, out of which only half of the crowd is interested in that activity and few people doesn't want to participate, and so that can be one of the factor. And few of the activities are very expensive where we require many of the items, so we have to also thought of the budget and logistics involved. And many attendees also feels that like I have given the questionnaire, few of us try to attempt all, few of us doesn't. So but some people are that like she has done, why I cannot do that? So maybe there can occur a competition between one another. So we also need to avoid that. So, but what are the do's? While if we are, I'm planning a team building or trust building activity in a team, like in amongst ourselves, if I want to plan. So what I have to ensure that it has to be clear in objective. What I want from that activity, we should know that. Like, and it should, the activity should be like that, that it include the whole audience. Nobody should feel left out. And always remembers that the trainings like BLS, ACLS, especially ACLS and PALS or ATLS, when we have team activities where the team resuscitation codes are run. So we have usually seen that doctors are always, I have seen in few centers where doctors make one group with the instructor and all nurses or other paramedic staffs are put in other group. But we should always ensure that when we are part of training where a mixed crowd is there, the group should also be mixed. So always leave your titles at the door, and the activity should be like that, that we have to include all of them. And always do ask for the feedback as we discussed today also, because it helps us in further improvement and further correction. And quickly I'll go through the do nots. Do nots, as I said, the activity shouldn't be boring. It should, we have to always ensure that the fun has to be there. Why? Because with the fun we learn so many things. If it's boring, then it is not interested and will not pay attention. And always remember that whenever we are planning trust building activities or such activities where fun is involved, where we want to have actual fun and learnings, so it should never be scheduled after the work hours. Either it should be a schedule during the working days. It should not be scheduled on Saturdays and Sundays where the employees are having their own personal things, and they should not feel that the organization or we are not kind of giving importance to their personal work. So always ensure that the activities are done during the work weekdays or when they are working. So these are the kind of resources from where I took this information. So with this, I will end my topic, and here with the saying of Stephen Covey that when trust is high, communication is easy, instant, and effective. So, so this is why we need to have a trust. So when trust is there, there is a more flow of communication, and it is instant and effective. Thank you so much.
Thank you, Santoshi. Can you please stop?
Yes, ma'am. I'll stop that.
Incidentally, I didn't have a chance to look at your presentation. You just shared that paper. Normally, I have one-on-one interaction with everybody who makes presentation. We went beyond the scope of the topic. I think we got to talk about the building trust activities, but I think it was a wonderful presentation. You did try to touch upon a lot of other aspects of the topic. Any questions for Santoshi? Aditi, you want to sleep? Okay. Okay. So, Dr. Kundan, without wasting time, I would request you to complete your presentation. I know it's already 10:40.
Yeah, thank you, madam. Is my presentation visible?
Yes, we can see it. Yes.
Yeah, so good evening, everyone. First, I'd like to congratulate Dr. Santoshi and Dr. Payal for a wonderful presentation. I have a very short presentation on the topic of introducing puzzles to introduce our topic. Okay, so how we can introduce puzzles in our pedagogy, or in a way, will it help us to introduce a topic? So what are the objectives of this presentation? Introduction to puzzles, the types of puzzles, the advantages of puzzles, and puzzles' role in pedagogy. So I think let us begin with the activity. We all know we are tired today, and at the end of the day and after end of the session, I would like everyone's answer on this picture puzzle. It's a classic case of optical illusion. So how many human faces are seen in this picture? You can say it, or you know, how many human faces are there in this picture?
I can see 5.
Any more answers? Yes.
Is that 6?
Yes, any more? I hope it is visible to all clearly.
Yeah. 1, 2, 3. It's 4.
I still stick on to
7
5.
or 8. 8, 8. Yeah,
8.
7 or 8.
Oh,
7.
yeah. It's more.
So yeah, the answers can be like from 8, 7, 8, depending upon the observation skill and each observer's observation skill. So the
It's
correct
We
answer,
9.
can do anything.
yeah, this image is titled General Family's Illustration, arguably one of the most popular optical illusion of all time. So it's a very famous illusion created by Mexican artist Octavio Ocampo. So the correct answer is 10. Now I'll explain that. You can go back. We can go back to the picture. The first face is the obvious face of the general. Okay. So this there are total 3 faces of the general's faces, and so there are 3 faces: the general, the broader general, then the old man, and the lady with her child. So the child face also is there, and there are 4 faces around the crow which is sitting, the bird which is sitting. So if you
Yes.
focus at the bird which is sitting, you can find 5 faces. Sorry, 5 faces there, and one face opposite to where the bird is sitting at the corner. And I think so.
5. With the bird, I can see now 4. Where is the 5th one?
Yes, I
I'll
can
send.
see now.
So don't
Yeah,
worry, I'll
even
send.
Now I can see 9, but 10th I could not see.
So yes, a puzzle. So I think my purpose has been served about puzzles. The puzzle is a question, game, or toy, which you have to think about carefully in order to answer it correct. There are many definitions of a puzzle. I've tried to put a simplified version. It is a question or a game or a toy, which you have to think about carefully in order to answer it correctly or put it together properly. Now, puzzles develop memory skills as well as an ability to plan, test ideas, and solve problems. Also, it tests the observational skills. Now, different types of puzzle. There are many types of puzzle. I will just highlight few which are important. So, logic puzzle. The classical logic puzzle is of the 3 ducks. There are 2 ducks in front of a duck, 2 ducks behind a duck, and a duck in the middle. How many ducks are there? So, this is a classic puzzle of 3 ducks which we might have come across. Then there is a Sudoku, which is again in newspapers. This is a classic logical puzzle where the goal is to place the numbers 1 through 9 into a grid, such that each row, each column, and each 3x3 box contains all 9 numbers only once. Then there is a word puzzle, which we all have solved maybe in the newspaper. So word search puzzle, which is there. Now mechanical puzzles, handheld puzzle objects that must be manipulated, that Rubik's Cube, to achieve a specific goal. Now, what are the advantages of puzzle? Studies have shown that, for example, jigsaw puzzles can help improve visuospatial reasoning, short-term memory, and problem solving skills. Puzzles stimulate problem solving skills in the student, in the children, and also in the audience, as well as combat cognitive decline, which can reduce risk of developing dementia in elderly patients also. So it stimulates the brain. It also improves the memory. It improves the problem solving skills. So working on a puzzle reinforces synaptic connections between brains. It is a too technical explanation, but it reinforces synaptic connections between brain cells, improves mental speed, and is an effective way to improve short-term memory. Puzzles also increase the production of dopamine. If somebody solves a puzzle, it gives a excitement, or there is instant release of dopamine, which is a happy hormone, or which is a chemical that regulates mood, behavior, and concentration. So dopamine is released with every success as we solve the puzzle. Puzzles require patience and concentration, which can help improve focus and attention span. Just like the optical illusion puzzle, what we saw, it required focus, it required attention span. Okay, it also required patience and concentration. But some puzzles also require analytical thinking, as you have to figure out how the pieces fit together, like jigsaw puzzle. The games help to improve cognitive skills, critical thinking, and logical reasoning, just like the 3-duck puzzle. Now, also puzzles help in social skills also. Putting together a puzzle can be a social activity. Audience can work together in groups to complete a puzzle, helping them understand teamwork and taking turns. Puzzles in the form of crossword and word search are structural, self-learning educational tools that review and reinforce knowledge and concepts acquired during the lecture. Now, coming to our core topic of puzzles' role in pedagogy. Now, puzzles can be used as an introduction to a topic, or it can also be used as during the lunch break, immediately after the lunch break, where the audience concentration may not be there, or even so that helps in a way. It can be used at the start of the topic or during the lunch break, where you want the audience to be back on the focus. A traditional lecture-based pedagogy conveys information and content, but it lacks sufficient development of critical thinking skills and problem solving. A puzzle-based pedagogy creates a broader contextual framework and fosters critical thinking as well as logical reasoning skills that can then be used to improve a student's performance or audience performance on content-specific assessment. It also helps in breaking the ice. Okay, it gets audience proactively involved. It gets the audience attention on a single point. Okay, so it is an opportunity to focus the attention of all the audience on a single point puzzle. So that also helps in getting the audience on the same page. It is what I feel, it fosters teamwork among the audience. Like, for example, we are taking it is a pedagogy, or there is a session for training of hospital staff. There can be doctors, there can be nurses, there can be junior doctors, consultants. So when there is a puzzle, all this audience, coming from different degree background, they can work together on a single puzzle. So there is an opportunity of bringing all the audience on the same page. So it fosters again the team building. But what are the do's of the puzzle? The puzzle should be simple. It should not be too complicated. Simple puzzles help. It should be having only one answer, mostly. It should be contextual to the topic. It should not be too long. It should not be stretched too long. If the puzzle goes on for many, say 15 minutes, half an hour, then the purpose of introducing the puzzle is defeated. So it should be short. At the same time, it should be simple. It should have only one answer. There should not be any controversies in the answers, preferably. It also should be contextual. Also, it should not be on a controversial topic like religious or political. These days, people are very sensitive to any religious or political issues. So the puzzle should, as far as possible, not touch these controversial areas, should not be offensive also to some religion or to particular group of group of the audience. And it should not be time consuming. It should be short, crisp. Just like my presentation today. Thank you.
Thank you, Dr. Kundan. Can you stop sharing the screen? Thank you for the presentation. I think it was well covered. I think all of you have done a very good job. Santoshi, Payal, and Dr. Kundan, you have put in a lot of hard work to make your presentation interesting and meaningful also. Please do share the presentation in the group so that everybody can have a look at the presentation. And are there any questions? Anything that you wish to say or ask? Yeah, excellent presentation by all. I agree with you. So let's meet next Wednesday. Though I had requested a change of date for 5th, but then some of you had some challenge. So we stick back to the old plan and we have our next session on coming Wednesday. I've shared the feedback form for the presentation, not for the presenters, but for the topic that I covered. So I request you to give your feedback either today or maybe tomorrow morning. That's all right. Thank you so much. I think I'll not hold you further. It's almost 3 hours. Thank you for being so patient.
Thank you, ma'am. Thank you.
Thank you.
Thank you, ma'am. Thank you, everyone. Thank you.
Thank you, madam.
Good
Thank
night,
you,
ma'am.
madam.
Good
Good
night.
night. And good night.
Thank you. Yeah.